Hey Alpha Nurses, I'm Licensure from alphanursesguide.com. This is 150 NCLEX questions and one case study. Without delay, let's get started.
The husband of a client who was diagnosed 6 years ago with Alzheimer's disease approaches a nurse and says, "I'm so excited that my wife is starting to use donepezil for her illness." The nurse should tell the husband, 1. The medication is effective mostly in the early stages of the illness. 2. The adverse effects of the drug are numerous. 3. The client will attain a functional level of that of 6 years ago. 4. Effectiveness in the terminal phase of the illness is scientifically proven. The correct answer is 1. When compared with other similar medications, donepezil has fewer adverse effects. Donepezil is effective primarily in the early stages of the disease. The drug helps to slow the progression of the disease if started in the early stages. After the client has been diagnosed for 6 years, improvement to the level seen 6 years ago is highly unlikely. Data are not available to support the drug's effectiveness for clients in the terminal phase of the disease. A nurse on the geropsychiatric unit receives a call from the son of a recently discharged client. He reports that his father just got a prescription for memantine to take on top of his donepezil. The son then asks, why does he have to take extra medicines? The nurse should tell the son, 1. Maybe the Aricept alone isn't improving his dementia fast enough or well enough. 2. Namenda and Aricept are commonly used together to slow the progression of dementia. 3. Namenda is more effective than Aricept. Your father will be tapered off the Aricept. 4. Aricept has a short half-life and Namenda has a long half-life. They work well together. The correct answer is 2. The two medicines are commonly given together. Neither medicine will improve dementia, but may slow the progression. Neither medicine is more effective than the other. They act differently in the brain. Both medicines have a half-life of 60 or more hours. A multigravida client admitted to the labor area is scheduled for a cesarean birth under spinal anesthesia. After instructions by the anesthesiologist, the nurse determines that the client has understood the instructions when she says which of the following? 1. The medication will be administered while I am in prone position. 2. The anesthetic may cause severe headache, which is treatable. 3. My blood pressure may increase if I lie down too soon after the injection. 4. I can expect immediate anesthesia that can be reversed very easily. The correct answer is 2. Spinal anesthesia is used less commonly today because of preference for epidural block anesthesia. One of the adverse effects of spinal anesthesia is a spinal headache caused by leakage of spinal fluid from the needle insertion. This can be treated by applying a cool cloth to the forehead, keeping the client in a flat position, or using a blood patch that can clot and seal off any further leakage of fluid. Spinal anesthesia is administered with the client in a sitting position or side lying. Another adverse effect of spinal anesthesia is hypotension caused by vasodilation. General anesthesia provides immediate anesthesia, whereas the full effects of spinal anesthesia may not be felt for 20 to 30 minutes. General anesthesia can be discontinued quickly when the anesthesiologist administers oxygen instead of nitrous oxide. Epidural anesthesia may take 1 to 2 hours to wear off. When obtaining a history from the parents of a child diagnosed with diarrhea due to salmonella, the nurse should ask the parents if the child has been exposed to which of the following possible sources of infection. 1. Non-refrigerated custard. 2. A pet canary. 3. Undercooked eggs. 4. Unwashed fruit. The correct answer is 3. Diarrhea related to Salmonella bacilli is commonly spread by raw or undercooked fowl and eggs, pet turtles, and kittens. Food poisoning caused by Staphylococcus species is commonly spread by inadequately cooked or refrigerated custards, cream fillings, or mayonnaise. Psittacosis, a respiratory illness, may be spread by canaries. Contaminated, unwashed fruit is associated with typhoid fever, a disorder rarely seen in the United States. When teaching the parent of an infant with Hirschsprung's disease who received a temporary colostomy about the types of foods the infant will be able to eat, which of the following would the nurse recommend? 1. High-fiber diet. 2. Low-fat diet. 3. High-residue diet. 4. regular diet. The correct answer is 4. A regular diet would be recommended for the child with a colostomy. No special diet is needed. High-fiber foods, such as fruits and vegetables, should be minimized because they increase the bulk in the stool. Fat is necessary for brain growth in the first year of life. A high-residue diet would result in bulkier stools and increased gas production, which will collect in the colostomy bag. Therefore, a high-residue diet is not indicated. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. After surgery for gastric cancer, a client is scheduled to undergo radiation therapy. It will be most important for the nurse to include information about which of the following in the client's teaching plan. 1. Nutritional intake. 2. Management of alopecia. 3. Exercise and activity levels. 4. Access to community resources. The correct answer is 1. Clients who have had gastric surgery are prone to postoperative complications, such as dumping syndrome and postprandial hypoglycemia, which can affect nutritional intake. Vitamin absorption can also be an issue depending on the extent of the gastric surgery. Radiation therapy to the upper gastrointestinal area also can affect nutritional intake by causing anorexia, nausea, and esophagitis. The client would not be expected to develop alopecia. Exercise and activity levels, as well as access to community resources, are important teaching areas, but nutritional intake is a priority need. A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2 and 3. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician. A client has been diagnosed with avoidant personality disorder. He reports loneliness, but has fears about making friends. He also reports anxiety about being rejected by others. In designing a long-term treatment plan, in what order, from first to last, should the nurse include the following? 1. Teach the client anxiety management and social skills. 2. Ask the client to join one of his chosen activities with the nurse and 2 other clients. 3. Talk with the client about his self-esteem and his fears. 4. Help the client make a list of small group activities at the center he would find interesting. The correct order is 3, 1, 4, and 2. The client needs a stepwise plan for developing a social life. He needs to first work on his self-esteem and reduce his fears of rejection before talking about how to decrease his anxiety and learning new social skills. Helping him choose interesting activities is important before suggesting an activity for him. Then he will be ready to try a structured activity with the nurse present for support and role modeling. When communicating with a client who is experiencing dementia and exhibiting decreased attention and increased confusion, which of the following interventions should the nurse employ as the first step? 1. Using gentle touch to convey empathy. 2. Rephrasing questions a client doesn't understand. 3. Eliminating distracting stimuli, such as turning off the television. 4. Asking the client to go for a walk while talking. The correct answer is 3. Competing and excessive stimuli lead to sensory overload and confusion. Therefore, the nurse should first eliminate any distracting stimuli. After this is accomplished, Then using touch and rephrasing questions are appropriate. Going for a walk while talking has little benefit on attention and confusion. When developing a plan of care for a client diagnosed with a personality disorder, the nurse plans to assist the client primarily with which of the following? 1. Specific dysfunctional behaviors. 2. Psychopharmacologic compliance. 3. Examination of developmental conflicts. 4. Manipulation of the environment. The correct answer is 1. The nurse should plan to assist a client who has a personality disorder primarily with specific dysfunctional behaviors that are distressing to the client or others. The client with personality disorder has lifelong, inflexible, and dysfunctional patterns of relating and behaving. The client commonly does not view his behavior as distressful to himself. The client becomes distressed because of others' reactions and behaviors toward him, which cause the client emotional pain and discomfort. Psychopharmacologic compliance is not a primary need because medication does not cure personality disorder. Medication is prescribed if the client has a severe symptom that interferes with functioning, such as severe anxiety or depression, or if the client has an Axis 1 disorder. Examination of developmental conflicts usually is not helpful because of the ingrained dysfunctional ways of thinking and behaving. It is more useful to help the client with changing dysfunctional behaviors. Although milieu management is a component of care, the client usually is proficient in manipulation of the environment to meet his needs. The nurse, while shopping in a local department store, hears a multiparous woman say loudly, "I think the baby's coming." After asking someone to call 911, the nurse assists the client to give birth to a term neonate. While waiting for the ambulance, the nurse suggests that the mother initiate breastfeeding, primarily for which of the following reasons? 1. To begin the parental-infant bonding process. 2. To prevent neonatal hypothermia. 3. To provide glucose to the neonate. 4. To contract the mother's uterus. The correct answer is 4. After emergency birth. The nurse suggests that the mother begin breastfeeding to contract the uterus. Breastfeeding stimulates the natural production of oxytocin. In a multiparous client, uterine atony is a potential complication because of the stretching of the uterine fibers following each subsequent pregnancy. Although breastfeeding does help to begin the parental-infant bonding process, this is not the primary reason for the nurse to suggest breastfeeding. Prevention of neonatal hypothermia is accomplished by placing blankets on both the neonate and the mother. Although colostrum in breast milk provides a neonate with nutrients and immunoglobulins, the primary reason for breastfeeding is to stimulate the natural production of oxytocin to contract the uterus. Which of the following will be most appropriate for the nurse to teach the mother of a 6-month-old infant hospitalized with severe diarrhea to help her comfort her infant who is fussy? 1. Offering a pacifier. 2. Placing a mobile above the crib. 3. Sitting at crib side talking to the infant. 4. Turning the television on to cartoons. The correct answer is 1. Typically, an infant hospitalized with severe diarrhea receives fluid replacement intravenously rather than orally. Oral fluids and food are usually withheld. Although activities such as placing a mobile over the crib, speaking to the infant, or turning on the television may provide distraction for or helping calming the infant, a fussy infant receiving nothing by mouth is usually best comforted by providing a pacifier to satisfy sucking needs. Which of the following instructions should the nurse expect to include in the discharge teaching plan for the parent of an infant who has had an inguinal herniorrhaphy? 1. Change diapers as soon as they become soiled. 2. Apply an abdominal binder. 3. Keep the incision covered with a sterile dressing. 4. Restrain the infant's hands. The correct answer is 1. Changing a diaper as soon as it becomes soiled helps prevent wound infection, the most common complication after inguinal hernia repair in an infant secondary to possible wound contamination with urine and stool. Because the surgical wound is unlikely to separate, an abdominal binder is unnecessary. The incision may or may not be covered with a dressing. If a dressing is not used, the primary care provider may apply a topical spray to protect the wound. Restraining the infant's hands is unnecessary if the diaper is applied snugly. The infant would be unable to get the hands into the diaper close to the surgical site. A client has been diagnosed with adenocarcinoma of the stomach and is scheduled to undergo a subtotal gastrectomy, Bill Roth 2 procedure. During preoperative teaching, the nurse is reinforcing information about the surgical procedure. Which of the following explanations is most accurate? 1. The procedure will result in enlargement of the pyloric sphincter. 2. The procedure will result in anastomosis of the gastric stump to the jejunum. 3. The procedure will result in removal of the duodenum. 4. The procedure will result in repositioning of the vagus nerve. The correct answer is 2. A Bill Roth 2 procedure bypasses the duodenum and connects the gastric stump directly to the jejunum. The pyloric sphincter is removed, along with some of the stomach fundus. A client who has had the jaws wire begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse determines that the son of a client with Alzheimer's disease needs further education about the disease when he makes which of the following statements? 1. I didn't realize the deterioration would be so incapacitating. 2. The Alzheimer's support group has so much good information. 3. I get tired of the same old stories, but I know it's important for Dad. 4. I woke up this morning expecting that my old dad would be back. The correct answer is 4. The statement about expecting that the old dad would be back conveys a lack of acceptance of the irreversible nature of the disease. The statement about not realizing that the deterioration would be so incapacitating is based in reality. The statement about the Alzheimer's group is based in reality and demonstrates the son's involvement with managing the disease. Stating that reminiscing is important reflects a realistic interpretation on the son's part. A client has been admitted to the emergency room. The client's family tells the nurse that the client has suddenly become lethargic and is not making sense. The client has not had anything to eat or drink for the last 8 hours. The nurse further assesses the client using the confusion assessment method. The client's responses to questions are rambling, and the client is not able to focus clearly to answer the nurse's questions. Based on these findings, the nurse should report that the client has 1. Dementia, 2. Depression, 3. Delirium, 4. Dehydration. The correct answer is 3. Based on CM assessment tool, the client has an acute onset of behaviors, is inattentive, has disorganized thinking, and is lethargic, decreased level of consciousness. This cluster of behaviors constitutes delirium. Dementia has a slow onset. The client's level of consciousness is usually normal, and the client can focus attention. Clients who are depressed are alert and oriented and able to focus attention, although may be easily distracted. Further assessment is needed to determine if the client also is dehydrated. The nurse has obtained a urine specimen from AG6. P5 client admitted to the labor unit. The woman asked to go to the bathroom and reports that she feels she has to move her bowels. Which actions would be appropriate? Select all that apply. 1. Assisting her to bathroom. 2. Applying an external fetal monitor to obtain fetal heart rate. 3. Assessing her stage of labor. 4. Asking if she had back labor pains like this with any of her other childbirth experiences. 5. Allowing her support person to take her to the bathroom to maintain privacy. 6. Checking the degree of fetal descent. The correct answers are 3 and 6. The pressure from the fetus descending into the birth canal can cause the client to feel she needs to move her bowels and could be near childbirth. Failure to assess the stage of labor and degree of fetal descent before allowing the client to go to the bathroom may lead progression of labor and could result in a birth in the bathroom. Applying a fetal monitor may reassure the nurse that the fetus is doing well. However, it does not help to determine if the fetus is ready to be born, which is a higher priority in this situation, regardless of the client's prior experience with back labor pain. The fetal head moving lower into the birth canal causes pressure in the lower back area similar to the feeling of pressure with a bowel movement. A child undergoes rehydration therapy after having diarrhea and dehydration. A nurse is teaching the child's parents about dietary management. The nurse understands that the teaching plan has been successful when the parents tell the nurse that they will follow which type of diet? 1. Regular. 2. Clear liquid. 3. Full liquid. 4. Soft. The correct answer is 1. Dietary management following rehydration for diarrhea and mild dehydration would include offering the child a regular diet. Following rehydration, there is no need for the child to be on a special diet, such as a clear liquid, full liquid, or soft diet. When teaching the mother of an infant who has received a temporary colostomy for treatment of Hirschsprung's disease about how the stoma should normally appear, which of the following descriptions about the stoma's appearance should the nurse include in the teaching? 1. Becoming dark brown in 2 months. 2. Staying deep red in color. 3. Changing to several shades of pink. 4. Turning almost purple in color. The correct answer is 2. Typically, the stoma should remain deep red in color as long as the infant has a colostomy. A dark red to purplish color may indicate impaired circulation to the stoma. What should the nurse teach a client about how to avoid the dumping syndrome? Select all that apply. 1. Consume 3 regularly spaced meals per day. 2. Eat a diet with high carbohydrate foods with each meal. 3. Reduce fluids with meals but take them between meals. 4. Obtain adequate amounts of protein and fat in each meal. 5. Eat in a relaxing environment. The correct answers 3, 4, and 5. Dumping syndrome results in excessive, rapid emptying of gastric contents. The nurse should instruct the client to avoid dumping syndrome by eating small, frequent meals rather than 3 large meals, having a diet high in protein and fat and low in carbohydrates, reducing fluids with meals but taking them between meals, and relaxing when eating. The client should eat slowly and regularly and rest after meals. A client with a peptic ulcer reports epigastric pain that frequently causes a client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1, 2, 3, and 4. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension, if not actively bleeding, and decreases distension and release of gastrin. Medication should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. The nurse manager of a psychiatric unit notices that one of the nurses commonly avoids a 75-year-old client's company. Which of the following factors should the nurse manager identify as being the most likely cause of this nurse's discomfort with older clients? 1. Fears and conflicts about aging. 2. Dislike of physical contact with older people. 3. A desire to be surrounded by beauty and youth. 4. Recent experiences with her mother's elderly friends. The correct answer is 1. The most common reason for the nurse's discomfort with elderly clients is that she has not examined her own fears and conflict about aging. Until nurses resolve their fears, It is unlikely that they will feel comfortable with elderly clients. A dislike of physical contact with older people, a desire to be surrounded by beauty and youth, and recent experiences with a parent's elderly friends are possible explanations, but not common or likely. The term motor apraxia relates to a decline in motor patterns essential for complex motor tasks. However, the client with severe dementia may be able to perform which of the following actions? 1. Balance a checkbook accurately. 2. Brush the teeth when handed a toothbrush. 3. Use confabulation when telling a story. 4. Find misplaced car keys. The correct answer is 2. Highly conditioned motor skills, such as brushing teeth, may be retained by the client who has dementia and motor apraxia. Balancing a checkbook involves calculations, a complex skill that is lost with severe dementia. Confabulation is fabrication of details to fill a memory gap. This is more common when the client is aware of a memory problem, not when dementia is severe. Finding keys is a memory factor, not a motor function. The healthcare provider has performed an amniotomy on a laboring client. Which of the following details must be included in the documentation of this procedure? Select all that apply. 1. Time of rupture. 2. Color and clarity of fluid. 3. Fetal heart rate and pattern before and after the procedure. 4. Size of amnio hook used during the procedure. 5. Odor and amount of fluid. The correct answers are 1, 2, 3, and 5. The time of rupture, color, odor, amount, and clarity of amniotic fluid, and FHR and pattern before and after procedure are all information that must be documented on the client's record. There is only one size for an amnio hook. A 30-year-old G3, P2 is being monitored internally. She is being induced with IV oxytocin because she is post-term. The nurse notes the pattern below. The client is wedged to her side while lying in bed and is approximately 6 centimeters dilated and 100% effaced. The nurse should first 1. Continue to observe the fetal monitor. 2. Anticipate rupture of the membranes. 3. Prepare for fetal oximetry. 4. Discontinue the oxytocin infusion. The correct answer is 4. The fetal monitor strip shows late decelerations. The first intervention would be to turn off the oxytocin because the medication is causing contractions. The stress caused by the contractions demonstrates that the fetus is not being perfused during the entire contraction, as shown by the late decelerations. There is no time to continue to observe in this situation. Intervention is a priority. The client is attached to an internal fetal monitor, which would be possible only if her membranes had already ruptured. If the fetus continues to experience stress, fetal oximetry may be initiated. A 3-year-old with dehydration has vomited 3 times in the last hour and continues to have frequent diarrhea stools. The child was admitted 2 days ago with gastroenteritis caused by rotavirus. The child weighs 22 kilograms, has a normal saline lock in his right hand, and has had 30 milliliters of urine output in the last 4 hours. Using the S-bar technique for communication, the nurse calls the primary healthcare provider with a recommendation for 1. Giving a dose of loperamide. 2. Starting a fluid bolus of normal saline. 3. Beginning an IV antibiotic. 4. Establishing a Foley catheter. The correct answer is 2. The child is dehydrated, is not able to retain oral fluids, and continues to have diarrhea. A normal saline bolus should be given followed by maintenance of IV fluids. Antidiarrheal medications are not recommended for children and will prolong the illness. The child has gastroenteritis caused by a viral illness. IV antibiotics are not indicated for viral illnesses. Strict I&O is important in all children with gastroenteritis. Preoperatively, the nurse develops a plan to prepare a 7-month-old infant psychologically for a scheduled herniorrhaphy the next day. Which of the following should the nurse expect to implement to accomplish this goal? 1. Explaining the preoperative and postoperative procedures to the mother. 2. Having the mother stay with the infant. 3. Making sure the infant's favorite toy is available. 4. Allowing the infant to play with surgical equipment. The correct answer is 2. The best way to prepare a 7-month-old infant psychologically for surgery is to have the primary caretaker stay with the child. Infants in the second 6 months of life commonly develop separation anxiety. Therefore, the priority in this case is to support the child by having the parent present. Teaching the mother what to expect may decrease her anxiety. This is important because infants sense anxiety and distress in parents, but the priority in this case is to have the parent present. Actual play and acting out life experiences are appropriate for preschool-age children. Allowing an infant to play with surgical equipment will be inappropriate and dangerous. A client with suspected gastric cancer undergoes an endoscopy of the stomach. Which of the following assessments made after procedure would indicate the development of a potential complication? 1. The client has a sore throat. 2. The client displays signs of sedation. 3. The client experiences a sudden increase in temperature. 4. The client demonstrates a lack of appetite. The correct answer is 3. The most likely complication of an endoscopic procedure is perforation. A sudden temperature spike within 1 to 2 hours after procedure is indicative of a perforation and should be reported immediately to the physician. A sore throat is to be anticipated after an endoscopy. Clients are given sedatives during the procedure, so it is expected that they will display signs of sedation after procedure is completed. A lack of appetite could be the result of many factors, including the disease process. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client, which instructions about positioning would be appropriate for the nurse to give a UAP. 1. Keep the client in a sideline position with the head slightly elevated. 2. Do not reposition the client without the assistance of a registered nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client, unless the client's condition warrants the presence of the nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for client. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When helping the families of clients with Alzheimer's disease cope with vulgar behaviors, which of the following suggestions is most helpful? 1. Ignore the behaviors, but try to identify the underlying need for behaviors. 2. Give feedback on the inappropriateness of the behaviors. 3. Employ anger management strategies. 4. Administer the prescribed risperidone. The correct answer is 1. The vulgar behaviors are commonly expressions of anger or more central needs that can be addressed directly. Therefore, the family should be encouraged to ignore behaviors but attempt to identify their purpose. Then the purpose can be addressed, possibly leading to a decrease in the behaviors. Because of impaired cognitive function, the client is not likely to be able to process the inappropriateness of the behaviors if given feedback. Likewise, anger management strategies will be ineffective because the client would probably be unable to process the inappropriateness of the behaviors. Risperidone may decrease agitation, but it does not improve social behaviors. The nurse is assessing an older adult for signs of dementia using the Minicog Dementia Assessment Tool. The nurse gives the client 3 words to remember: cat, crackers, and toys. After having the client perform a short task, the nurse asks the client to repeat the words. The client says toys, boys, and joys. The nurse should next: 1. Ask the client to repeat the original words 1 more time. 2. Note on the chart that the client has echolalia. 3. Refer the client to a healthcare provider for further follow-up. 4. Repeat the test when a family member is present. The correct answer is 3. That the client is not able to recall the 3 words is a likely indicator of dementia. The nurse should make a referral for further testing. It is recommended not to repeat the test a second time if the client is not able to recall the words. Although the client repeated rhyming words, echolalia refers to repletion of the same word. It is not necessary to have a family member present when conducting the test, but the nurse should communicate the findings to the family and encourage them to seek follow-up assessment. While the nurse is caring for a multiparous client in active labor at 36 weeks gestation, the client tells a nurse, "I think my water just broke." Which of the following should the nurse do first? 1. Turn the client to the right side. 2. Assess the color, amount, and odor of the fluid. 3. Assess the fetal heart rate pattern. 4. Check the client's cervical dilation. The correct answer is 3. After spontaneous rupture of the amniotic fluid, the gushing fluid may carry the umbilical cord out of the birth canal. Sudden deceleration of the fetal heart rate commonly signifies cord compression or prolapse of the cord, which will require immediate birth. This client is particularly at risk because the fetus is preterm and the fetal head may not be engaged. Turning the client to the right side is not a priority action. However, changing the client's position would be appropriate if variable decelerations are present. The nurse should assess the color, amount, and odor of the fluid, but this can be done once the fetal heart rate is assessed and no problems are detected. Cervical dilation should be checked, but only after the fetal heart rate pattern is assessed. A child is started on a soft diet after having been on clear liquids following an episode of severe gastroenteritis. When helping the mother choose foods for her child, which of the following foods would be most appropriate? 1. Muffins and eggs. 2. Bananas and rice cereal. 3. Bran cereal and a bagel. 4. Pancakes and sausage. The correct answer is 2. After clear liquids, the foods of choice are soft foods. These foods should be easily digested and low in fat. Additionally, the food should be non-bulk forming. Bananas and rice cereal are low in fat and easy to digest. Muffins and eggs, as well as sausage and pancakes, are typically high in fat and will be avoided. Although a bagel is low in fat, bran cereal is high in fiber and would be avoided because it may cause more diarrhea. An infant diagnosed with Hirschsprung's disease undergoes surgery with the creation of a temporary colostomy. Which of the following statements by the parent regarding the colostomy indicates the need for further teaching? 1. The colostomy is only temporary. 2. The colostomy will give time for the nerves to return to normal. 3. The colostomy may include 2 separate abdominal openings. 4. Right after the procedure, the stoma may appear purple. The correct answer is 2. The goal of the surgery is to remove the ganglionic portion of the intestine. The remaining intestines should have normal innervation. Colostomies are used to relieve the obstruction and allow the remaining intestines to return to normal size. A temporary loop or double-barrel colostomy has stomas for both the proximal and distal portion of the bowel. The final surgical repair is usually done when the infant is around 20 pounds. A new stoma is frequently swollen and bruised after surgery. A client who is recovering from a subdural gastrectomy experiences dumping syndrome. The client asks the nurse, "When will I be able to eat 3 meals a day again like I used to?" Which of the following responses by the nurse is most appropriate? 1. Eating 6 meals a day is time-consuming, isn't it? 2. You'll have to eat 6 small meals a day for the rest of your life. 3. You will be able to tolerate 3 meals a day before you are discharged. 4. Most clients can resume their normal meal patterns in about 6 to 12 months. The correct answer is 4. The symptoms related to dumping syndrome that occur after a gastrectomy usually disappear by 6 to 12 months after surgery. Most clients can begin to resume normal meal patterns after signs of the dumping syndrome have stopped. Acknowledging that eating 6 meals a day is time-consuming does not address the client's question and makes an assumption about the client's concerns. It is not necessarily true that a 6-meal-a-day dietary pattern will be required for the rest of the client's life. Clients will not be able to eat 3 meals a day before hospital discharge. A client with peptic ulcer disease is taking ranitidine. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Histamine, 2 receptor antagonists, such as ranitidine, reduce gastric acid secretion, and a secretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms. A nurse is planning care for an elderly client with cognitive impairment who is still living at home. Which action should the nurse identify as a priority for safety in planning care for this client? 1. Having 2 people accompany the client whenever the client is up and about. 2. Ensuring the removal of objects in the client's path that may cause him to trip. 3. Putting the client's favorite belongings in a safe place so that he will not lose them. 4. Giving the client his medications in liquid form to make certain that he swallows them. The correct answer is 2. When caring for a client with cognitive impairment, the priority is to ensure that all objects in the client's path are removed to prevent the client from falling. Additional measures, such as having 2 people accompany the client when he ambulates, placing his favorite things in safekeeping, and giving medications in a liquid form to be sure he swallows them, are less crucial and available. While assessing a client diagnosed with dementia, the nurse notes that her husband is concerned about what he should do when she uses vulgar language with him. The nurse should 1. Tell her that she is very rude. 2. Ignore the vulgarity and distract her. 3. Tell her to stop swearing immediately. 4. Say nothing and leave the room. The correct answer is 2. Vulgar language is common in clients with dementia when they are having trouble communicating about a topic. Ignoring the vulgarity and distracting her is appropriate. Telling the client she is rude or to stop swearing will have no lasting effect and may cause agitation. Just leaving the room is abandonment that the client will not understand. The nurse is explaining the medication options available for pain relief during labor. The nurse realizes the client needs further teaching when the client states which of the following? 1. Nalbuphine and promethazine will give relief from pain and nausea during early labor. 2. I can have an epidural as soon as I start contracting. 3. If I have a cesarean, I can have an epidural. 4. If I have an emergency cesarean, I may be put to sleep for the birth. The correct answer is 2. Typically, a client will be able to have an epidural when she is 3 to 4 centimeters dilated or the active phase of labor has been established. Waiting until the cervix is dilated to this point ensures that the client is in labor and the epidural is less likely to halt labor contractions. Nalbuphine and promethazine are used to provide relief until the client is about 7 centimeters dilated. If given after this time, narcotics may cause neonatal respiratory depression in the neonate. The majority of clients have an epidural or spinal for cesarean section. The only time general anesthesia is used is for an emergency cesarean section. A 31-year-old multigravida client at 39 weeks gestation, admitted to the hospital in active labor, is receiving intravenous lactated Ringer solution and a continuous epidural anesthetic. During the first hour after administration of the anesthetic, the nurse should monitor the client for 1. Hypotension. 2. Diaphoresis. 3. Headache. 4. Tremors. The correct answer is 1. When a client receives an epidural anesthetic, sympathetic nerves are blocked along with the pain nerves, possibly resulting in vasodilation and hypotension. Other adverse effects include bladder distension, prolonged second stage of labor, nausea and vomiting, pruritus, and delayed respiratory depression for up to 24 hours after administration. Diaphoresis and tremors are not usually associated with the administration of epidural anesthesia. Headache, a common adverse effect of many drugs, also is not associated with administration of epidural anesthesia. The primary care provider prescribes an intravenous infusion of 5% dextrose in 0.45 normal saline to be infused at 2 milliliters per kilogram per hour in an infant who weighs 9 pounds, or 4.1 kilograms. How many milliliters per hour of the solution should the nurse infuse? Round to 1 decimal. Blank ml per hour. The correct answer is 8.2 milliliters per hour. You multiply 4.1 kilograms by 2. Since it's 2 milliliters per kilograms per hour, you get 8.2. The primary care provider is able to reduce an infant's hernia and schedules the infant for a herniorrhaphy in 2 days. The mother asks the nurse why the surgery is not performed now. Which of the following responses indicates that the nurse understands the rationale for delaying the surgery? 1. Delaying the surgery ensures that your infant will receive the proper preoperative preparation. 2. We need to make sure that your infant receives nothing by mouth for at least 24 hours before the surgery. 3. Waiting these 2 days helps to allow any edema and inflammation in the area to subside. 4. Your infant needs to wear a truss for at least 24 hours before any surgery can be attempted. The correct answer is 3. If non-operative reduction is successful, delaying surgery for 2 to 3 days allows the edema and inflammation in the inguinal area to subside. Thus, the area to be operated will appear more normal, helping to decrease the risk of complications. The preoperative preparation for a herniorrhaphy is minimal and is not the reason for delaying the surgery. Typically, the infant is fed until a few hours before surgery to prevent dehydration. Trusses do not prevent incarceration, and there is no reason to use a truss preoperatively. The nurse should assess the client who is being admitted to the hospital with upper GI bleeding for which of the following? Select all that apply. 1. Dry, flush skin. 2. Decreased urine output. 3. Tachycardia. 4. Widening pulse pressure. 5. Rapid respirations. 6. Thirst. The correct answers are 2, 3, 5, and 6. The client who is experiencing upper GI bleeding is at risk for developing hypovolemic shock from blood loss. Therefore, the signs and symptoms the nurse should expect to find are those related to hypovolemia, including decreased urine output, tachycardia, rapid respirations, and thirst. The client's skin would be cool and clammy, not dry and flushed. The client would also be likely to develop hypotension, which would lead to a narrowing pulse pressure, not a widening pulse pressure. A client who was in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate postoperative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. The priority of care in the immediate postoperative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client with Alzheimer's disease may have delusions about being harmed by staff and others. When the client expresses fear of being harmed by staff, which of the following responses is most appropriate? 1. What makes you think we want to harm you? 2. We like you too much to want to harm you. 3. You are in the hospital. We are nurses trying to help you. 4. Oh, don't be so silly. No one wants to harm you here. The correct answer is 3. The nurse needs to present reality without arguing with the delusions. Therefore, stating that the client is in the hospital and the nurses are trying to help is most appropriate. The client doesn't recognize the delusion or why it exists. Telling the client that the staff likes him too much to want to harm him is inappropriate because the client believes the delusions and doesn't know that they are false beliefs. It also restates the word harm, which may reinforce the client's delusions. Telling the client not to be silly is condescending and disparaging and therefore inappropriate. A laboring client smiles pleasantly at the nurse when asked simple questions. The client speaks only Mandarin, and the interpreter is busy with an emergency situation. At her last vaginal examination, the client was 5 centimeters dilated, 100% effaced, and at 0 station. While working with this client, which of the following responses indicates that the client may be approaching birth? 1. The fetal monitor strip shows late decelerations. 2. The client begins to speak to her family in her native language. 3. The fetal monitor strip shows early decelerations. 4. The client's facial expressions become animated. The correct answer is 3. When the fetal head is compressed, early decelerations are seen as a vagal response occurs, and the fetal heart rate decelerates and inversely mirrors a contraction. This response commonly occurs when the client is 9 to 10 centimeters dilated or pushing. If communication cannot be facilitated, early decelerations are one indicator that birth may be approaching. Late decelerations may occur at this time, but indicate uteroplacental insufficiency rather than imminent birth. At any time during the labor process, the client may communicate with her family in her native language. The client's facial expressions may change at any point during labor and cannot be used as an indicator of imminent birth. While a client is being admitted to the birthing unit, she states, "My water broke last night, but my labor started 2 hours ago." Which of the following is concern? Select all that apply. 1. Maternal vital signs. Temperature, 99.5, heart rate, 80, respiration. 24, blood pressure 130/80. 2, blood and mucus on perineal pad. 3, baseline fetal heart rate of 140 with a range between 110 and 160 with contractions. 4, peripad stained with green fluid. 5, the client states, "This baby wants out. He keeps kicking me." The correct answers are 3, 4, and 5. The range of fetal heart rate fluctuating too high and low could indicate fetal distress. The green peripad fluid indicates meconium, which could be associated with fetal distress. Increased fetal activity during labor may also indicate distress. The maternal vital signs noted and a perineal pad with blood and mucus are normal findings. The stool culture of a child with profuse diarrhea reveals Salmonella bacilli. After teaching the mother about the course of Salmonella enteritidis, which of the following statements by the mother indicates effective teaching? 1. Some people become carriers and stay infectious for a long time. 2. After the acute stage passes, the organism is usually not present in the stool. 3. Although the organism may be alive indefinitely, in time it will be of no danger to anyone. 4. If my child continues to have the organism in the stool, an antitoxin can help destroy the organism. The correct answer is 1. After having S. Enteritidis. Some clients become chronic carriers of the causative organism and remain infectious for a long time as the organism continues to be shed from the body. During this time, the child is still considered infectious. No antitoxin is available to treat or prevent salmonella infections. The nurse is showing the parent of a child with Hirschsprung's disease where the ganglionic area is located. Identify the area the nurse should point out as being a ganglionic. 1A, 2B, 3C, 4D. The correct answer is 4. In most instances, the absence of ganglionic innervation occurs in the lower portion of the sigmoid colon, just above the anus. To reduce the risk of dumping syndrome, the nurse should teach the client to do which of the following? 1. Sit upright for 30 minutes after meals. 2. Drink liquid with meals, avoiding caffeine. 3. Avoid milk and other dairy products. 4. Decrease the carbohydrate content of meals. The correct answer is 4. Carbohydrates are restricted, but protein including meat and dairy products, is recommended because it is digested more slowly. Lying down for 30 minutes after meal is encouraged the slow movement of the food bolus. Fluids are restricted to reduce the bulk of food. There is no need to avoid caffeine. A client admitted to the hospital with peptic ulcer disease tells the nurse about having black, tarry stools. The nurse should 1. Encourage the client to increase fluid intake. 2. Advise the client to avoid iron-rich foods. 3. Place the client on contact precautions. 4. Report the finding to the healthcare provider. The correct answer is 4. Black, tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digestate blood in the stool causes it to be black. The odor of the stool is very offensive. The nurse should instruct the client to report the incidence of black stools promptly to the primary healthcare provider. Increasing fluids or avoiding iron-rich foods will not change the stool color or consistency if the stools contain digestate blood. Until other information is available, it is not necessary to initiate contact precautions. When assessing an aggressive client, which of the following behaviors warrants the nurse's prompt reporting and use of safety precautions? 1. Crying when talking about his divorce. 2. Starting a petition to delay bedtime. 3. Declining attendance at a daily group therapy session. 4. Naming another client as his adversary. The correct answer is 4. The client exhibits aggression against his perceived adversary when he names another client as his adversary. The staff will need to watch him carefully for signs of impending violent behavior that may injure others. Cry about a divorce would be appropriate, not pathologic, behavior demonstrating grief over a loss. A petition to delay bedtime would be a positive, direct action aimed at a bothersome situation. Although declining to attend group therapy needs follow-up, there may be any number of unknown reasons for this action. The client with dementia states to the nurse, "I know you. You're Margaret, the girl who lives down the street from me." Which of the following responses by the nurse is most therapeutic? 1. Miss Jones, I'm Rachel, a nurse here at the hospital. 2. Now, Miss Jones, you know who I am. 3. Miss Jones, I told you already I'm Rachel and I don't live down the street. 4. I think you forgot that I'm Rachel, Miss Jones. The correct answer is 1. Because of the client's short-term memory impairment. The nurse gently corrects the client by stating her name and who she is. This approach decreases anxiety, embarrassment, and shame and maintains the client's self-esteem. Telling the client that she knows who the nurse is or that she forgot can elicit feelings of embarrassment and shame. Saying, "I told you already" sounds condescending, as if blaming the client for not remembering. A full-term client is admitted for induction of labor. When admitted, her cervix is 25/0. The initial goal is cervical ripening prior to labor induction. Which drug will prepare her cervix for induction? 1. Nalbuphine. 2. Oxytocin. 3. Dinoprostone. 4. Betamethasone. The correct answer is 3. Cervical ripening, or creating a cervix that is soft, anterior, and dilated to 2 to 3 centimeters, must occur before the cervix can efface and dilate with oxytocin. Drugs that accomplish this goal include dinoprostone, misoprostol, and prostaglandin E2. Nalbuphine is a narcotic analgesic used in early labor and has no influence on the cervix. Betamethasone is a corticosteroid given to mature fetal lungs. A multigravida laboring client has an extensive documented history of drug addiction. Her last reported usage was 5 hours ago. She is 2 centimeters dilated with contractions every 3 minutes of moderate intensity. The primary healthcare provider prescribes Nalbuphine 15 milligrams slow IV push for pain relief followed by an epidural when the client is 4 centimeters dilated. Within 10 minutes of receiving the Nalbuphine, the client states she thinks she is going to have her baby now. Of the following drugs available at the time of the birth, which should the nurse avoid using with this client in this situation? 1. 1% lidocaine. 2. Naloxone hydrochloride. 3. Local anesthetic. 4. Pudendal block. The correct answer is 2. Naloxone hydrochloride would not be used in a client who has a history of drug addiction. Narcan would abruptly withdraw this woman from the drug she is addicted to, as well as the nalbuphine. The withdrawal would occur within a few minutes of injection and, if severe enough, could jeopardize the mother and fetus. Xylocaine is a local anesthetic and numbs rather than decreases the effects of Narcan. The local anesthetic and the pudendal block are both appropriate for this birth, but are used to numb the maternal perineum for birth. Which of the following will be the best activity for the nurse to include in the plan of care for an infant experiencing severe diarrhea? 1. Monitoring the total 8-hour formula intake. 2. Weighing the infant each day. 3. Checking the anterior fontanelle every shift. 4. Monitoring abdominal skin turgor every shift. The correct answer is 2. Because an infant experiencing severe diarrhea is at high risk for a fluid volume deficiency, the nurse needs to evaluate the infant's fluid balance status by weighing the infant at least every day. Body weight is the best indicator of hydration status because a higher proportion of an infant's body weight is water compared with an adult. Initially, the infant with severe diarrhea is not allowed liquids, but is given fluids intravenously. Therefore, monitoring the oral intake of formula is inappropriate. Although checking the anterior fontanelle for depression or bulging provides information about hydration status, this method is not considered the best indicator of the infant's fluid balance. Monitoring skin turgor can provide information about fluid volume status. The abdomen is commonly used to assess skin turgor in an infant because it is a large surface area and can be accessed quickly. However, weight is the best indicator of fluid balance. When assessing an infant with suspected inguinal hernia, which of the following findings will be most significant? 1. The inguinal swelling is reddened and the abdomen is distended. 2. The infant is irritable and a thickened spermatic cord is palpable. 3. The inguinal swelling can be reduced and the infant has a stool in a diaper. 4. The infant's diaper is wet with urine and the abdomen is non-tender. The correct answer is 1. Abdominal distension and a redness of the inguinal swelling are significant findings. Their presence in conjunction with area tenderness and inability to reduce the hernia indicate an incarcerated hernia. An incarcerated hernia can lead to strangulation, necrosis, and gangrene of the bowel. Other findings associated with strangulation include irritability, anorexia, and difficulty in defecation. Irritability is nonspecific and can be caused by various factors. A palpable, thickened spermatic cord on the affected side is diagnostic of inguinal hernia and would be an expected finding. A wet diaper indicates that urine is being excreted, a finding unrelated to inguinal hernia. Which of the following would be an expected outcome for a client with peptic ulcer disease? The client will 1. Demonstrate appropriate use of analgesics to control pain. 2. Explain the rationale for eliminating alcohol from the diet. 3. Verbalize the importance of monitoring hemoglobin and hematocrit every 3 months. 4. Eliminate engaging in contact sports. The correct answer is 2. Alcohol is a gastric irritant that should be eliminated from the intake of the client with peptic ulcer disease. Analgesics are not used to control ulcer pain. Many analgesics are gastric irritants. The client's hemoglobin and hematocrit typically do not need to be monitored every 3 months unless gastrointestinal bleeding is suspected. The client can maintain an active lifestyle and does not need to eliminate contact sports as long as they are not stress-inducing. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you'll be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following is a priority to include in the plan of care for a client with Alzheimer's disease who is experiencing difficulty processing and completing complex tasks? 1. Repeating the directions until the client follows them. 2. Asking the client to do one step of the task at a time. 3. Demonstrating for client how to do the task. 4. Maintaining routine and structure for client. The correct answer is 2. Because the client is experiencing difficulty processing and completing complex tasks, the priority is to provide the client with only one step at a time, thereby breaking the task up into simple steps, ones that the client can process. Repeating the directions until the client follows them or demonstrating how to do the task is still too overwhelming to the client because of the multiple steps involved. Although maintaining structure and routine is important, it is unrelated to task completion. A nurse and a nursing assistant are caring for clients in a labor and birth unit. Which task should the nurse assign to the nursing assistant? 1. Perform a fundal check on a 2-day postpartum client. 2. Remove a fetal monitor and assist a client to the bathroom. 3. Give ibuprofen 800 milligrams by mouth to a newly postpartum client. 4. Teach a new mother how to bottle feed her infant. The correct answer is 2. Removing a fetal monitor from a client and assisting her to the bathroom are within the realm of practice of a nursing assistant. Performing a fundal check is an assessment, which is a responsibility of a nurse. A nursing assistant is not permitted to administer medication by any route. Education is also part of the professional nursing role. Although a nursing assistant can assist a mother with bottle feeding, the formal client education must be completed and validated by the nurse. When assessing the frequency of contractions of a multiparous client in active labor admitted to the birthing area, the nurse should assess the interval between which of the following. 1. Acme of one contraction to the beginning of the next contraction. 2. Beginning of one contraction to the end of the next contraction. 3. End of one contraction to the end of the next contraction. 4. Beginning of one contraction to the beginning of the next contraction. The correct answer is 4. To assess the frequency of the client's contractions, the nurse should assess the interval from beginning of one contraction to beginning of the next contraction. The duration of contraction is the interval between the beginning and the end of a contraction. The acme identifies the peak of a contraction. Which of the following would alert the nurse to suspect that a child with severe gastroenteritis who has been receiving intravenous therapy for the past several hours may be developing circulatory overload? 1. A drop in blood pressure. 2. Change to slow, deep respirations. 3. Auscultation of moist crackles. 4. Marked increase in urine output. The correct answer is 3. An early sign of circulatory overload is moist rales or crackles heard when auscultating over the chest wall. Elevated blood pressure, engorged neck veins, a wide variation between fluid intake and output, with a higher intake and output, shortness of breath, increased respiratory rate, dyspnea, and cyanosis occur later. When developing the preoperative plan of care for an infant with Hirschsprung's disease, which of the following should the nurse include? 1. Administering a tap water enema. 2. Inserting a gastrostomy tube. 3. Restricting oral intake to clear liquids. 4. Using povidone iodine solution to prepare the perineum. The correct answer is 3. Before intestinal surgery, dietary intake is limited to clear liquids for 24 to 48 hours. A clear liquid diet meets the child's fluid needs and avoids the formation of fecal material in the intestine. Typically, repeated saline enemas, not tap water enemas, are given to empty the bowel. Soap suds enemas are contraindicated for infants, as are tap water enemas. A nasogastric tube may be inserted for gastric decompression. Insertion of a gastrostomy tube is outside the scope of nursing practice. Because the perineal area is not involved in the surgery, it does not need to be prepared. After a subdural gastrectomy, the nurse is developing a plan with the client to assist the client to gain weight. To help the client meet nutritional goals at home, the nurse should 1. Instruct the client to increase the amount eaten at each meal. 2. Encourage the client to eat smaller amounts more frequently. 3. Explain that if vomiting occurs after meal, nothing more should be eaten that day. 4. Inform the client that bland foods are typically less nutritional and should be used minimally. The correct answer is 2. Because of the client's reduced stomach capacity, frequent small feedings are recommended. Early satiety can result, and large quantities of food are not well tolerated. Each client should progress at his or her own pace, gradually increasing the amount of food eaten. The goal is 3 meals daily if possible, but this can take 6 months or longer to achieve. Nausea can be episodic and can result from eating too fast or eating too much at one time. Eating less and eating more slowly, rather than not eating at all, can be a solution. Bland foods are recommended as starting foods because they are easily digested and are less irritating to the healing mucosa. Bland foods are not less nutritional. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2, 4, and 5. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. When developing a teaching plan for the community about managed care models and their effect on clients with chronic mental illnesses, which of the following factors should the nurse include as detrimental to this population? Select all that apply. 1. Restriction in the range and quantity of services. 2. Hospitalization reserved for emergency services. 3. Non-shifting of funding to outpatient services when clients are moved to these services. 4. Loss of the principle of least restrictive alternative for care. 5. Lack of sufficient numbers of group homes and supervised apartments. The correct answers are 1 and 3. Without a sufficient range and quantity of services, care is inadequate and hospitalization rates increase. Non-shifting of allocated funding to outpatient services has increased the problem with the range and quantity of services. Reserving hospitalization for emergency services was a practice before managed care. The principle of least restrictive alternative is still as relevant as it was before managed care. There are not enough group homes available. A client with early dementia exhibits disturbances in her mental awareness and orientation to reality. The nurse should expect to assess a loss of ability in which of the following other areas? 1. Speech. 2. Judgment. 3. Endurance. 4. Balance. The correct answer is 2. Clients with chronic cognitive disorders experience defects in memory orientation and intellectual functions, such as judgment and discrimination. Loss of other abilities, such as speech, endurance, and balance, is less typical. A full-term client is admitted for an induction of labor. The healthcare provider has assigned a Bishop score of 10. Which drug would the nurse anticipate administering to this client? 1. Oxytocin 30 units in 500 milliliters D5W. 2. Prostaglandin gel 0.5 milligrams. 3. Misoprostol 50 micrograms PO. 4. Dinoprostone 10 milligrams. The correct answer is 1. A Bishop score evaluates cervical readiness for labor based on 5 factors: cervical softness, cervical effacement, dilation, fetal position, and station. A Bishop score of 5 or greater in a multipara, or a score of 8 or greater in a primipara, indicate that a vaginal birth is likely to result from the induction process. The nurse should expect that labor will be induced using oxytocin because the Bishop score indicates that the client is 60% to 70% effaced, 3 to 4 centimeters dilated, and in an anterior position. The cervix is soft and the presenting part is at a -1 to 0 position. Prostaglandin gel, misoprostol, and dinoprostone are all cervical ripening agents, and the doses are accurate. However, cervical ripening has already taken place. A multigravida client is admitted at 4 centimeters dilation and requesting pain medication. The nurse gives the client nalbuphine 15 milligrams. Within 5 minutes, the client tells the nurse she feels like she needs to have a bowel movement. The nurse should first: 1. Have naloxone hydrochloride available in the birthing room. 2. Complete a vaginal examination to determine dilation, effacement, and station. 3. Prepare for birth. 4. Document the client's relief due to pain medication. The correct answer is 2. The feeling of needing to have a bowel movement is commonly caused by pressure on the receptors low in the perineum when the fetal head is creating pressure on them. This feeling usually indicates advances in fetal station and that the client may be close to birth. The nurse should respond initially to the client's signs and symptoms by checking to validate current effacement, dilation, and station. If the fetus is ready to be born, having the room ready for the birth and having naloxone hydrochloride available are important. Narcan completely or partially reverses the effects of natural and synthetic opioids, including respiratory depression. Documenting pain relief takes time away from a vaginal examination, preparing for birth, and obtaining Narcan. The birth may be occurring rapidly. Being prepared for the birth is a higher priority than documentation for this client. Which of the following would be an important assessment finding for an 8-month-old infant admitted with severe diarrhea? 1. Bowel sounds every 5 seconds. 2. Pale yellow urine. 3. Normal skin elasticity. 4. Depressed anterior fontanelle. The correct answer is 4. An infant with severe diarrhea will experience some degree of dehydration. In an 8-month-old child, the anterior fontanelle has not closed. Therefore, a depressed anterior fontanelle would be an important finding. Additionally, the infant would exhibit dry mucous membranes, lethargy, hyperactive bowel sounds, dark urine, and sunken eyeballs. Skin turgor will be decreased or delayed. Bowel sounds every 5 seconds would not be considered abnormal for an infant. An infant is to be discharged after surgery for intussusception. In developing the discharge teaching plan, the nurse should tell the mother: 1. The infant will experience a change in the normal home routine. 2. The infant can return to the pre-hospital routine immediately. 3. The infant needs to ingest more calories at home than what was consumed in the hospital. 4. The infant will continue to experience abdominal cramping for a few days. The correct answer is 1. Infants who have had an interruption in their normal routine and experiences, such as hospitalization and surgery, typically manifest behavior changes when discharged. The infant's normal routine has been significantly altered, so it will take time to reestablish another routine. Calorie requirements at home will continue to be the same as those in the hospital. The infant does not need more calories at home. The surgical procedure corrected the problems, so the infant should not continue to have abdominal cramping. A client is taking an antacid for treatment of a peptic ulcer. Which of the following statements best indicates that the client understands how to correctly take the antacid? 1. I should take my antacid before I take my other medications. 2. I need to decrease my intake of fluids so that I don't dilute the effects of my antacid. 3. My antacid will be most effective if I take it whenever I experience stomach pains. 4. It is best for me to take my antacid 1 to 3 hours after meals. The correct answer is 4. Antacids are most effective if taken 1 to 3 hours after meals and at bedtime, when an antacid is taken on an empty stomach. The duration of the drug's action is greatly decreased. Taking antacids 1 to 3 hours after a meal lengthens the duration of action, thus increasing the therapeutic action of the drug. Antacids should be administered about 2 hours after other medications to decrease the chance of drug interactions. It is not necessary to decrease fluid intake when taking antacids. If antacids are taken more frequently than recommended, the likelihood of developing adverse effects increases. Therefore, the client should not take antacids as often as desired to control pain. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun and syphilis, use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The family of a client diagnosed with Alzheimer's disease wants to keep the client at home. They say that they have the most difficulty in managing his wandering. The nurse should instruct the family to do which of the following? Select all that apply. 1. Ask the primary healthcare provider for a sleeping medication. 2. Install motion and sound detectors. 3. Have a relative sit with the client all night. 4. Have the client wear a medical alert bracelet. 5. Install door alarms and high door locks. The correct answers are 2, 4, and 5. Motion and sound detectors, a medical alert bracelet, and door alarms are all appropriate interventions for wandering. Sleep medications do not prevent wandering before and after the client is asleep and may have negative effects. Having a relative sit with the client is usually an unrealistic burden. A charge nurse and an LPN are working in the labor and birth unit. Of the following assessments and interventions that must be done immediately, which should the charge nurse assign to the LPN? 1. Complete an initial assessment on a client. 2. Increase the oxytocin rate on a laboring client. 3. Perform a straight catheterization for protein analysis. 4. Recover a mother following cesarean birth. The correct answer is 3. The straight catheterization is within the scope of practice of a licensed practical nurse. An initial or continuing assessment is the responsibility of the registered nurse. Assessment must be complete before increasing the IV rate of oxytocin. The assessment and the increase in oxytocin rate are responsibilities for the registered nurse. The RN, not the LPN, recovers clients who have had surgery because frequent assessments are needed. 2 hours ago, a multigravida client was admitted in active labor with her cervix dilated at 5 centimeters and completely effaced and the fetus at 0 station. Currently, the client is experiencing nausea and vomiting, a slight chill with perspiration beads on her lip, and extreme irritability. The nurse should first 1. Warm the temperature of the room by a few degrees. 2. Increase the rate of intravenous fluid administration. 3. Obtain a prescription for an intramuscular antiemetic medication. 4. Assess the client's cervical dilation and station. The correct answer is 4. The nurse should assess the client's cervical dilation and station because the client's symptoms are indicative of the transition phase of labor. Multiparous clients can proceed 5 to 9 centimeters per hour during the active phase of labor. Warming the temperature of the room is not helpful because the client will soon be ready to begin expulsive pushing. Increasing the intravenous fluid rate is not warranted unless the client is experiencing dehydration. Administration of an antiemetic at this point in labor is not warranted and may result in neonatal depression should a rapid birth occur. The primary care provider prescribes intravenous fluid replacement therapy with potassium chloride to be added for a child with severe gastroenteritis. Before adding the potassium chloride to the intravenous fluid, which of the following assessments will be most important? 1. Ability to void. 2. Passage of stool today. 3. Baseline electrocardiogram. 4. Serum calcium level. The correct answer is 1. Potassium chloride is readily excreted in the urine. Before adding potassium chloride to the IV fluid, the nurse should ascertain whether the child can void. If not, potassium chloride may build up in the serum and cause hyperkalemia. An electrocardiogram could be done during intravenous potassium replacement therapy to evaluate for these changes. Having a stool daily is important, but because potassium is primarily excreted in the urine, the child's ability to void must be verified. Serum calcium levels do not indicate the child's ability to tolerate potassium replacement. After teaching the parents of an infant diagnosed with Hirschsprung's disease, the nurse determines that the parents understand the diagnosis when the father states which of the following? 1. There is no rectal opening for stool to pass. 2. There is a tube between the trachea and esophagus. 3. The nerves at the end of the large colon are missing. 4. The muscle below the stomach is too tight. The correct answer is 3. The primary defect in Hirschsprung's disease is an absence of autonomic parasympathetic ganglion cells in the distal portion of the colon. Thus, the nerves at the end of the large colon are missing. Absence of a rectal opening refers to an imperforate anus. A tube between the trachea and esophagus refers to a tracheoesophageal fistula. Presence of a tight muscle below the stomach refers to pyloric stenosis. Following a gastrectomy, the nurse should position the client in which of the following positions? 1. Prone. 2. Supine. 3. Low Fowlers. 4. Right or left Sims. The correct answer is 3. A client who has had abdominal surgery is best placed in a low Fowler's position postoperatively. This positioning relaxes abdominal muscles and provides for maximum respiratory and cardiovascular function. The prone, supine, or Sims position would not be tolerated by a client who has had abdominal surgery, nor do those positions support respiratory or cardiovascular functioning. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. 1. Epigastric pain at night. 2. Relief of epigastric pain after eating. 3. Vomiting. 4. Weight loss. 5. Melena. The correct answers are 3, 4, and 5. Vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools from gastric bleeding. Clients with a gastric ulcer are most likely to have a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during the night and is frequently relieved by eating. A client reports having blurred vision after 4 days of taking haloperidol 1 milligram twice a day and benztropine 2 milligrams twice a day. The nurse contact the primary healthcare provider to explain the situation, background, and assessment and make a recommendation. Which information reported to the primary healthcare provider is the assessment of the situation. 1. Mr. Roberts is taking 1 milligram of Haldol twice a day and Cogentin 2 milligrams twice a day. 2. I think Mr. Roberts might need a lower dose of Cogentin. 3. Mr. Roberts reports having blurred vision since this morning. 4. The higher dose of Cogentin could be causing Mr. Roberts' blurred vision. The correct answer is 4. Cogentin has a common side effect of blurred vision. After evaluating the relative doses of Haldol and Cogentin, the assessment would be that the higher dose of Cogentin compared to the dose of Haldol is responsible for the blurred vision. High doses of Haldol can cause blurred vision at times. Reporting that Mr. Roberts has blurred vision is the situation. Listing the medications and doses is describing the background. The recommendation would be a lower dose of cogentin. A client is experiencing agnosia as a result of vascular dementia. She is staring at dinner and utensils without trying to eat. Which intervention should the nurse attempt first? 1. Pick up the fork and feed the client slowly. 2. Say, "It's time for you to start eating your dinner." 3. Hand the fork to client and say, "Use this fork to eat your green beans." 4. Save the client's dinner until her family comes in to feed her. The correct answer is 3. Agnosia is the lack of recognition of objects and their purpose. The nurse should inform the client about the fork and what to do with it. Feeding the client does not address the agnosia or give the client specific directions. It should only be attempted if identifying the fork and explaining what to do with it is ineffective. Waiting for the family to care for the client is not appropriate unless identifying the fork and explaining or feeding the client is not successful. A client at 33 weeks gestation is admitted in preterm labor. She is given betamethasone 12 milligrams IM every 24 hours times 2. What is the expected outcome of this drug therapy? 1. The contractions will end within 24 hours. 2. The client will give birth to a neonate without infection. 3. The client will give birth to a full-term neonate. 4. The neonate will be born with mature lungs. The correct answer is 4. Betamethasone is a corticosteroid that induces the production of surfactant. The pulmonary maturation that results causes the fetal lungs to mature more rapidly than normal. Because the lungs are mature, the risk of respiratory distress in the neonate is lowered but not eliminated. Betamethasone also decreases the surface tension within the alveoli. Betamethasone has no influence on contractions or carrying the fetus to full term. It also does not prevent infection. A nurse is preparing a change of shift report and has been caring for a multigravida client with a normally progressing labor. Which of the following information should be part of this report? Select all that apply. 1. Interpretation of the fetal monitor strip. 2. Analgesia or anesthesia being used. 3. Anticipated method of birth control. 4. Amount of vaginal bleeding or discharge. 5. Support persons with the client. 6. Prior birth history. The correct answers are 1, 2, 4, 5, and 6. Knowledge of how the fetus is tolerating contractions, as well as the frequency, intensity, and duration of contractions, as indicated on the fetal monitor strip, are extremely important. The type of analgesia or anesthesia being used, the client's response, and her pain rating should be included as well. The amount of vaginal bleeding indicates whether this labor is in the normal range. Vaginal discharge indicates if membranes are ruptured in the color, odor, and amount of amniotic fluid. The support persons with the client are an integral part of the labor process and greatly influence how she manages labor emotionally and, commonly, physically. A complete change of shift report will include the client's name, age, gravida, and parity, current and prior illnesses that may influence this hospitalization, prior labor and birth history if applicable, last vaginal examination time and findings, vaginal bleeding, support persons with client, current IVs and other medications being used, and pertinent laboratory test results. Future plan for birth control would be the least important information to be given to the next shift because it will not impact the labor care plan. Which of the following will most likely alert the nurse to the possibility that a preschooler is experiencing moderate dehydration? 1. Deep, rapid respirations. 2. Diaphoresis. 3. Absence of tear formation. 4. Decreased urine specific gravity. The correct answer is 3. The absence of tears is typically found when moderate dehydration is observed as the body attempts to conserve fluids. Other typical findings associated with moderate dehydration include a dry mouth, sunken eyes, poor skin turgor, and an increased pulse rate. Deep, rapid respirations are associated with severe dehydration. Decreased perspiration, not diaphoresis, would be seen with moderate dehydration. The specific gravity of urine increases with decreased output in the presence of dehydration. Which of the following assessments should be the priority for an infant who has had surgery to correct an intussusception and is now at risk for development of a paralytic ileus postoperatively? 1. Measurement of urine specific gravity. 2. Auscultation of bowel sounds. 3. Inspection of the first stool passed. 4. Measurement of gastric output. The correct answer is 2. Development of a paralytic ileus postoperatively is a functional obstruction of the bowel. Bowel sounds initially may be hyperactive, but then they diminish and cease. Measurement of urine specific gravity provides information about fluid and electrolyte status. The first stool and the amount of gastric output provide information about the return of gastric function. A client has been taking aluminum hydroxide 30 milliliters 6 times per day at home to treat a peptic ulcer. The client has been unable to have a bowel movement for 3 days. Based on this information, the nurse would determine that which of the following is the most likely cause of the client's constipation. 1. The client has not been including enough fiber in the diet. 2. The client needs to increase the daily exercise. 3. The client is experiencing an adverse effect of the aluminum hydroxide. 4. The client has developed a gastrointestinal obstruction. The correct answer is 3. It is most likely that the client is experiencing an adverse effect of the antacid. Antacids, aluminum salt products, such as aluminum hydroxide, form insoluble salts in the body. These precipitate and accumulate in the intestines, causing constipation. Increasing dietary fiber intake or daily exercise may be a beneficial lifestyle change for the client, but is not likely to relieve the constipation caused by the aluminum hydroxide. Constipation, in isolation from other symptoms, is not a sign of a bowel obstruction. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and the nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occurred during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is a priority at this time. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When developing a plan of care for a client with Alzheimer's disease who is experiencing moderate impairment, which of the following types of care should the nurse expect to include? 1. Prompting and guiding activities of daily living. 2. Managing a medication schedule. 3. Constant supervision and total care. 4. Supervision of risky activities, such as shaving. The correct answer is 1. Considerable assistance is associated with moderate impairment when the client cannot make decisions but can follow directions. Managing medications is needed even in mild impairment. Constant care is needed in the terminal phase when the client cannot follow directions. Supervision of shaving is appropriate with mild impairment. That is, when the client still has motor function but lacks judgment about safety issues. As a nurse begins her shift on the obstetrical unit, there are several new admissions. The client with which of the following conditions would be a candidate for induction? 1. Preeclampsia. 2. Active herpes. 3. Face presentation. 4. Fetus with late decelerations. The correct answer is 1. The client with preeclampsia would be a candidate for the induction process because ending the pregnancy is the only way to cure preeclampsia. A client with active herpes would be a candidate for a cesarean section to prevent the fetus from contracting the virus while passing to the birth canal. The woman with a face presentation will not be able to give birth vaginally due to the extended position of the neck. The client whose fetus exhibits late decelerations without oxytocin would be at greater risk for fetal distress with use of this drug. Late decelerations indicate the fetus does not have enough placental reserves to remain oxygenated during the entire contraction. This client may require a cesarean section. Which of the following would the nurse expect as a common finding for a multiparous client giving birth to a viable neonate at 41 weeks gestation with the aid of a vacuum extractor? 1. Caput succedaneum. 2. Cephalohematoma. 3. Maternal lacerations. 4. Neonatal intracranial hemorrhage. The correct answer is 1. Caput succedaneum is common after the use of a vacuum extractor to assist the client's expulsion efforts. This edema may persist up to 7 days. Vacuum extraction is not associated with cephalohematoma. Maternal lacerations may occur, but they are more common when forceps are used. Neonatal intracranial hemorrhage is a risk with both vacuum extraction and forceps births, but it is not a common finding. A 9-month-old is admitted because of dehydration. How should the nurse go about accurately monitoring fluid intake and output? Select all that apply. 1. Weighing and recording all wet diapers. 2. Change breastfeedings to bottle feedings. 3. Obtaining an accurate daily weight. 4. Restricting fluids prior to weighing the child. 5. Obtaining an accurate stool count. The correct answers are 1, 3, and 5. Accurate intake and output recording includes noting all intake, including IV fluids, noting output, such as emesis and stool, weighing diapers, measuring weight daily, measuring urine-specific gravity, monitoring serum electrolytes, and monitoring for signs of dehydration. Children who are dehydrated must receive sufficient fluid intake, but having a breastfeeding child switch to bottle feeding will not promote intake. Restricting fluids just prior to weighing the child will not alter the accuracy of the weight, and the nurse should continue to encourage fluids for this dehydrated child. An infant diagnosed with Hirschsprung's disease is scheduled to receive a temporary colostomy. When initially discussing the diagnosis and treatment with the parents, which of the following would be most appropriate? 1. Assessing the adequacy of their coping skills. 2. Reassuring them that their child will be fine. 3. Encouraging them to ask questions. 4. Giving them printed material on the procedure. The correct answer is 3. By encouraging parents to ask questions during information sharing sessions, the nurse can clarify misconceptions and determine the parent's understanding of information. A better understanding of what is happening allows the parents to feel some control over the situation. Assessing the adequacy of the parents' coping skills is important, but secondary to encouraging them to express their concerns. The questions they ask and their interactions with a nurse may provide clues to the adequacy of their coping skills. The nurse should never give false reassurance to parents. At this point, there is no way for the nurse to know whether the child will be fine. Written materials are appropriate for augmenting the nurse's verbal communication. However, these are secondary to encouraging questions. A client who is recovering from gastric surgery is receiving IV fluids to be infused at 100 milliliters per hour. The IV tubing delivers 15 drops per milliliter. The nurse should infuse the solution at a flow rate of how many drops per minute to ensure that the client receives 100 milliliters per hour? Blank drops per minute. The correct answer is 25 drops per minute. To administer IV fluids at 100 milliliters per hour using tubing that has a drip factor of 15 drops per milliliter, the nurse should use the following formula. 100 milliliters over 60 minutes multiplied by 15 drops over 1 milliliter, which equals to 25 drops per minute. A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden, sharp pain in the mid-epigastric region, along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize the perforation. A nasogastric tube may be used following surgery. An elderly client who has been diagnosed with delusional disorder for many years is exhibiting early symptoms of dementia. His daughter lives with him to help him manage daily activities, and he attends a daycare program for seniors during the week while she works. A nurse at the daycare center hears him say, "If my neighbor puts up a fence, I'll blow him away. He has never respected my property line, and I've had it." Which of the following actions should the nurse take? 1. Observe the client more closely, but do not report his threat, since he will likely not be able to follow through with it because of his dementia. 2. Report the comment to the client's daughter so she can observe him more closely, but refrain from telling the neighbor due to privacy regulations. 3. Report the comment to the neighbor, the intended victim, but refrain from telling the daughter since she will just worry about actions of her father she cannot control. 4. Report the comment to the neighbor, the daughter, and the police since there is a potential for a criminal act. The correct answer is 4. The neighbor could be harmed as well as the daughter if she should try to stop her father, so both should be notified. The nurse has a legal/ethical responsibility to warn potential victims and other involved parties, as well as law enforcement authorities, when one person makes a threat against another person. This duty supersedes confidentiality statutes. Failure to do so and to document it can result in civil penalties. The client's early dementia would likely not prevent him from carrying through his threat. During a home visit to an elderly client with mild dementia, the client's daughter reports that she has one major problem with her mother. She says, "She sleeps most of the day and is up most of the night. I can't get a decent night's sleep anymore." Which suggestions should the nurse make to the daughter? Select all that apply. 1. Ask the client's primary healthcare provider for a strong sleep medicine. 2. Establish a set routine for rising, hygiene, meals, short rest periods, and bedtime. 3. Engage the client in simple, brief exercises or a short walk when she gets drowsy during the day. 4. Promote relaxation before bedtime with a warm bath or relaxing music. 5. Have the daughter encourage the use of caffeinated beverages during the day to keep her mother awake. The correct answers are 2, 3, and 4. A set routine and brief exercises help decrease daytime sleeping. Decreasing caffeine in fluids and promoting relaxation at bedtime promote nighttime sleeping. A strong sleep medicine for an elderly client is contraindicated due to changes in metabolism, increased adverse effects, and the risk of falls. Using caffeinated beverages may stimulate metabolism, but can also have long-lasting adverse effects and may prevent sleep at bedtime. A client is admitted at 30 weeks gestation with contractions every 3 minutes. Her cervix is 1 to 2 centimeters dilated and 75% effaced. Following a 4 grams bolus dose, IV magnesium sulfate is infusing at 2 grams per hour. How will the nurse know the medication is having the intended effect? 1. Contractions will increase in frequency, leading to birth. 2. The client will maintain a respiratory rate greater than 12 breaths per minute. 3. Contractions will decrease in frequency, intensity, and duration. 4. The The client will maintain blood pressure readings of 120/80. The correct answer is 3. The expected outcome of magnesium sulfate administration is suppression of the contractions because the client is in preterm labor. Magnesium sulfate is a smooth muscle relaxant used to slow and stop contractions. Having contractions that lead to birth is not the intended effect of this drug when used for preterm labor. Respirations lower than 12 breaths per minute may indicate magnesium sulfate toxicity. Another use of magnesium sulfate is to treat preeclampsia by preventing seizures and, secondarily, lowering maternal blood pressure. However, in this scenario, preterm labor, not preeclampsia, is being treated. A multigravida in active labor is 7 centimeters dilated. The fetal heart rate baseline is 130 beats per minute with moderate variability. The client begins to have variable decelerations to 100 to 110 beats per minute. What should the nurse do next? 1. Perform a vaginal examination. 2. Notify the primary healthcare provider of the decelerations. 3. Reposition the client and continue to evaluate the tracing. 4. Administer oxygen via mask at 2 liters per minute. The correct answer is 3. The cause of variable decelerations is cord compression, which may be relieved by moving the client to one side or another. If the client is already on the left side, changing the client to the right side is appropriate. Performing a vaginal examination will let the nurse know how far dilated the client is, but will not relieve the cord compression. If the decelerations are not relieved by position changes, oxygen should be initiated, but the rate should be 8 to 10 liters per minute. Notifying the primary healthcare provider should occur if turning the client and administering oxygen do not relieve the decelerations. A child is admitted with a tentative diagnosis of Shigella. The nurse should do which of the following? Select all that apply. 1. Assess the child for nausea and vomiting. 2. Collect a stool specimen for white blood cells. 3. Place the child on airborne precautions. 4. Monitor the child for signs and symptoms of dehydration. 5. Initiate an intake and output record. The correct answers are 1, 2, 4, and 5. Shigella is caused by the Shigella organism. Clinical manifestations of Shigella include fever, nausea, and vomiting, some cramping, headache, seizures, rectal prolapse, and loose, watery stools containing pus, mucus, and blood. The nurse should assess the child for these symptoms on an ongoing basis. Shigella is spread via direct contact with the organism, which is found in the stool. A stool specimen will show increased numbers of WBCs, blood, and mucus. Vomiting and loose stools can result in severe dehydration and electrolyte imbalance. Thus, the nurse should record intake, output, and daily weights. There is no need for strict isolation. Masks are not needed, as Shigella is not transmitted by airborne methods. A nasogastric tube inserted during surgery to correct an infant's intussusception is no longer freely removing gastric secretions. Which of the following should the nurse do next? 1. Aspirate the tube with a syringe. 2. Irrigate the tube with distilled water. 3. Increase the level of suction. 4. Rotate the tube. The correct answer is 1. The first action is to check the placement of the tube to ensure that it is in the correct position. To check tube position, the nurse should aspirate the tube with a syringe. A return of gastric contents indicates that the end of the tube is in the stomach. Another method is to inject a small amount of air while auscultating with a stethoscope over the epigastric area. The tube is irrigated with normal saline, not distilled water, and only after the position of the tube is confirmed. The suction level should not be increased, because doing so could damage the mucosa. Rotating the tube could irritate or traumatize the nasal mucosa. A client is to take 1 daily dose of ranitidine at home to treat a peptic ulcer. The client understands proper drug administration of ranitidine when the client will take the drug at which of the following times? 1. Before meals. 2. With meals. 3. At bedtime. 4. When pain occurs. The correct answer is 3. Ranitidine blocks secretion of hydrochloric acid. Clients who take only one daily dose of ranitidine are usually advised to take it at bedtime to inhibit nocturnal secretion of acid. Clients who take the drug twice a day are advised to take in the morning and at bedtime. It is not necessary to take the drug before meals. The client should take the drug regularly, not just when pain occurs. Amoxicillin trihydrate 300 milligrams PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer? Blank ml. The correct answer is 6 milliliters. The formula is 300 milligrams over X ml equal to 250 milligrams over 5 milliliters. You cross multiply and get 250X equals to 1500. You divide by 250 on both sides and you get 6 milliliters. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The client in the early stage of Alzheimer's disease and his adult son attend an appointment at the community mental health center. While conversing with a nurse, the son states, "I'm tired of hearing about how things were 30 years ago. Why does Dad always talk about the past?" The nurse should tell the son, 1. Your dad lost his short-term memory, but he still has his long-term memory. 2. You need to be more accepting of your dad's behavior. 3. I want you to understand your dad's level of anxiety. 4. Telling your dad that you are tired of hearing about the past will help him stop. The correct answer is 1. The son's statements regarding his father's recalling past events is typical for family members of clients in the early stage of Alzheimer's disease, when recent memory is impaired. Telling the son to be more accepting is critical and not an attempt to educate. Understanding the client's level of anxiety is unrelated to memory loss of Alzheimer's disease. The client cannot stop reminiscing at will. A nurse notices repetitive late decelerations on the fetal heart monitor. The best initial actions by the nurse include 1. Prepare for birth, reposition patient, and begin pushing. 2. Perform sterile vaginal exam. Increase IV fluids and apply oxygen. 3. Notify the provider. Explain findings to the patient and begin pushing. 4. Reposition patient, apply oxygen, and increase IV fluids. The correct answer is 4. Late decelerations on a fetal heart monitor indicate uteroplacental insufficiency. Interventions to improve perfusion include repositioning the patient, oxygen, and IV fluids. A sterile vaginal exam is not indicated at this time. Late decelerations are not expected findings and do not indicate an imminent birth. The primary health care provider plans to perform an amniotomy on a multiparous client admitted to the labor area at 41 weeks gestation for labor induction. After the amniotomy, the nurse should first 1. Monitor the client's contraction pattern. 2. Assess the fetal heart rate for 1 full minute. 3. Assess the client's temperature and pulse. 4. Document the color of the amniotic fluid. The correct answer is 2. After an amniotomy, the nurse should plan to first assess the FHR for 1 full minute. One of the complications of amniotomy is cord compression and or prolapse cord, and an FHR of 100 BPM or less should be promptly reported to the primary healthcare provider. A cord prolapse requires prompt birth by cesarean section. The client's contraction pattern should be monitored once labor has been established. The client's temperature, pulse, and respiration should be assessed every 2 to 4 hours after rupture of the membranes to detect an infection. The nurse should document the color, quantity, and odor of the amniotic fluid, but this can be done after the FHR is assessed and a normal pattern is present. The nurse teaches the father of an infant hospitalized with gastroenteritis about the next step of the treatment plan once the infant's condition has been controlled. The nurse determines that the father understands when he explains which of the following will occur with his infant. 1. The infant will receive clear liquids for a period of time. 2. Formula and juice will be offered. 3. Blood will be drawn daily to test for anemia. 4. The infant will be allowed to go to the playroom. The correct answer is 1. The usual way to treat an infant hospitalized with gastroenteritis is to keep the infant nothing by mouth status to rest the gastrointestinal tract. The resulting fluid volume deficit is treated with intravenous fluids. When the infant's condition is controlled, clear liquids are then started slowly. Formula and juice will be started once the infant's vomiting has subsided and the infant has demonstrated the ability to tolerate clear liquids for a period of time. In this situation, there is no need to test the infant's blood every day for anemia. Most likely, the infant's serum electrolyte levels will be monitored closely. Typically, an infant is placed in a private room because gastroenteritis is most commonly caused by a virus that is easily transmitted to others. A male adolescent who underwent repair of an inguinal hernia earlier today and is getting ready to go home receives instructions about resuming physical activities. Which of the following statements would indicate that he has understood the instructions? 1. I can start riding my bike next week. 2. I have to skip physical education classes for 2 weeks. 3. I can start wrestling again in 3 weeks. 4. I can return to my weightlifting class in 2 weeks. The correct answer is 3. Because of possible stress on the suture line, physical activities such as bicycle riding, physical education classes, weightlifting, and wrestling are contraindicated for about 3 weeks. After a subtotal gastrectomy, the nasogastric tube drainage will be what color for about 12 to 24 hours after surgery? 1. Dark brown. 2. Bile green. 3. Bright red. 4. Cloudy white. The correct answer is 1. About 12 to 24 hours after a subtotal gastrectomy, gastric drainage is normally brown, which indicates digested blood. Bile green or cloudy white drainage is not expected during the first 12 to 24 hours after a subtotal gastrectomy. Drainage during the first 6 to 12 hours contains some bright red blood, but large amounts of blood or excessive bloody drainage should be reported to the physician promptly. The nurse has been assigned to provide care for 4 clients. In what order should the nurse assess these clients? 1. A client awaiting surgery for a hiatal hernia repair at 11 a.m. 2. A client with suspected gastric cancer who is on nothing by mouth status for tests. 3. A client with peptic ulcer disease experiencing a sudden onset of acute stomach pain. 4. A client who is requesting pain medication 2 days after surgery to repair a fractured jaw. The correct order is 3, 4, 2, and 1. The client with peptic ulcer disease who is experiencing a sudden onset of acute stomach pain should be assessed first by the nurse. The sudden onset of stomach pain could be indicative of a perforated ulcer, which would require immediate medical attention. It is also important for the nurse to thoroughly assess the nature of the client's pain. The client with a fractured jaw is experiencing pain and should be assessed next. The nurse should then assess the client who is NPO for tests to ensure NPO status and comfort. Last, the nurse can assess the client before surgery. The nurse is making a home visit with a client diagnosed with Alzheimer's disease. The client recently started on lorazepam due to increased anxiety. The nurse is cautioning the family about the use of lorazepam. The nurse should instruct the family to report which of the following significant side effects to the healthcare provider? 1. Paradoxical excitement. 2. Headache. 3. Slowing of reflexes. 4. Fatigue. The correct answer is 1. Although all of the side effects listed are possible with lorazepam, paradoxical excitement is cause for immediate discontinuation of the medication. Paradoxical excitement is the opposite reaction to lorazepam than is expected. The other side effects tend to be minor and usually are transient. A client with dementia who prefers to stay in his room has been brought to the day room. After 10 minutes, the client becomes agitated and retreats to his room again. The nurse decides to assess the conditions in the day room. Which is the most likely occurrence that is disturbing to this client? 1. There is only one other client in the day room. The rest are in a group session in another room. 2. There are 3 staff members and 1 primary healthcare provider in the nurse's station working on charting. 3. A relaxation tape is playing in one corner of the room, and a television airing a special on crime is playing in the opposite corner. 4. A housekeeping staff member is washing off the countertops in the kitchen, which is on the far side of the day room. The correct answer is 3. The tape and television are competing. Even conflicting stimuli, crime events portrayed on television, could be misperceived as a real threat to the client. A low number of clients in the presence of a few staff members quietly working are less intense stimuli for the client and not likely to be disturbing. The primary health care provider determines that the fetus of a multiparous client in active labor is in distress, necessitating a cesarean birth with general anesthesia. Before the cesarean birth, the anesthesiologist prescribes cimetidine 300 milligrams PO. After administering the drug, the nurse should assess the client for reduction in which of the following? 1. Incidence of bronchospasm. 2. Oral and respiratory secretions. 3. Acid level of the stomach contents. 4. Incidence of postoperative gastric ulcer. The correct answer is 3. Cimetidine is prescribed by some anesthesiologists who will be giving a general anesthetic to reduce the level of acid in the stomach contents, altering the pH to reduce the risk of complications should aspiration of vomitus occur. Aspiration of vomitus is the 5th most common cause of maternal mortality. Most anesthesiologists insert an endotracheal tube to reduce the incidence of aspiration. Isoproterenol is used to decrease the incidence of bronchospasm. Atropine sulfate is administered to dry oral and nasal secretions. Although cimetidine is useful for gastric ulcer therapy, gastric ulcers are not a common effect associated with operative births. The mother of a toddler hospitalized for episodes of diarrhea reports that when her toddler cannot have things the way she wants, she throws her legs and arms around, screams, and cries. The mother says, "I don't know what to do." After teaching the mother about ways to manage this behavior, which of the following statements indicates that the nurse's teaching was successful? 1. Next time she screams and throws her legs, I'll ignore the behavior. 2. I'll allow her to have what she wants once in a while. 3. I'll explain why she cannot have what she wants. 4. When she behaves like this, I'll tell her that she's being a bad girl. The correct answer is 1. The child is demonstrating behavior associated with temper tantrums, which are relatively frequent normal occurrences during toddlerhood as the child attempts to develop a sense of autonomy. The development of autonomy requires opportunities for the child to make decisions and express individuality. Ignoring the outbursts is probably the best strategy. Doing so avoids rewarding the behavior and helps the child to learn limits, promoting the development of self-control. However, the mother should intervene in a temper tantrum if the child is likely to injure herself. Allowing the child to have what she wants occasionally would typically add to problems associated with temper tantrums, because doing so rewards the behavior and prevents the child from developing self-control. Toddlers do not possess a capacity to understand explanations about behavior. Expressing disappointment in the child's behavior or telling her that she is being a bad girl reinforces feelings of guilt and shame, thus interfering with the child's ability to develop a sense of autonomy. A nurse is caring for a 10-month-old, weighing 8.0 kilograms, who was admitted for dehydration. The infant has vomited 5 times in the last 3 hours and has had no wet diapers in the last 8 hours. The nurse informs the primary healthcare provider, which of the following prescriptions should the nurse question? 1. Begin an intravenous line of D5W.45% normal saline at 40 milliliters per hour. 2. NPO except for medication administration while vomiting persists. 3. Begin an intravenous line and administer a fluid bolus of dextrose 25%. 4. Strict intake and output, weighing all diapers. The correct answer is 3. The infant is in need of a fluid bolus. A fluid bolus should consist of an isotonic fluid, such as normal saline or lactated ringers. Dextrose 25% is not an appropriate bolus for dehydrated children because it could cause a fluid shift that may result in cerebral edema and death. D5.45% normal saline is an appropriate IV fluid for infants. The rate is 1.5 times maintenance for this child and is appropriate for the first 24 hours if the child is dehydrated. Once hydration is adequate, the infant's IV rate should be reduced to a maintenance rate. Vomiting is persistent, so it is appropriate for the child to be NPO. Strict INO is an appropriate prescription for all dehydrated children. When assessing a 4-month-old infant diagnosed with possible intussusception, the nurse should expect a mother to relate which of the following about the infant's crying and episodes of pain. 1. Constant accompanied by leg extension. 2. Intermittent with knees drawn to the chest. 3. Shrill during ingestion of solids. 4. Intermittent while being held in the mother's arms. The correct answer is 2. The infant with intussusception experiences acute episodes of colic-like abdominal pain. Typically, the infant screams and draws the knees to the chest. Between these episodes of acute abdominal pain, the infant appears comfortable and normal. Feeding does not precipitate episodes of pain. Additionally, a 4-month-old infant typically would not be ingesting solid foods. Pain exhibited by crying that occurs when the infant is placed in a reclining position, as in the mother's arms, is not associated with intussusception. This type of cry may indicate that the infant wants attention, wants to be held, or needs to have a diaper change. The nurse finds a client who has been diagnosed with a peptic ulcer surrounded by papers from a briefcase and arguing on the telephone with a co-worker. The nurse's response to observing these actions should be based on knowledge that 1. Involvement with the job will keep the client from becoming bored. 2. A relaxed environment will promote ulcer healing. 3. Not keeping up with the job will increase the client's stress level. 4. Setting limits on the client's behavior is an important nursing responsibility. The correct answer is 2. A relaxed environment is an essential component of ulcer healing. Nurses can help clients understand the importance of relaxation and explore with them ways to balance work and family demands to promote healing. Being involved with his work may prevent boredom. However, this client is upset and argumentative. Not keeping up with his job will probably increase the client's stress level, but the nurse's response is best if it is based on the fact that a relaxed environment is an essential component of ulcer healing. Nurses cannot set limits on a client's behavior. Clients must make the decision to make lifestyle changes. Which of the following interventions is most appropriate for a client who has stomatitis? 1. Drinking hot tea at frequent intervals. 2. Gargling with antiseptic mouthwash. 3. Using an electric toothbrush. 4. Eating a soft, bland diet. The correct answer is 4. Clients with stomatitis have significant discomfort, which impacts their ability to eat and drink. They will be most comfortable eating soft, bland foods and avoiding temperature extremes in their food and liquids. Gargling with an antiseptic mouthwash will be irritating to the mucosa. Mouth care should include gentle brushing with a soft toothbrush and flossing. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. While educating the daughter of a client with dementia about the illness, the daughter mentions to the nurse that her mother distorts things. The nurse understands that the daughter needs further teaching about dementia when she makes which statement? 1. I tell her reality, such as, that noise is the wind in the trees. 2. I understand the misperceptions are part of the disease. 3. I turn off the radio when we're in another room. 4. I tell her she is wrong, and then I tell her what's right. The correct answer is 4. Telling the client that she is wrong and then telling her what is right is argumentative and challenging. Arguing with or challenging distortions is least effective because it increases defensiveness. Telling the client about reality indicates awareness of the issues and is appropriate. Acknowledging that misperceptions are part of the disease indicates an understanding of the disease and an awareness of the issues. Turning off the radio helps to limit environmental stimuli and indicates an awareness of the issues. Following an epidural and placement of internal monitors, a client's labor is augmented. Contractions are lasting greater than 90 seconds and occurring every 1.5 minutes. The uterine resting tone is greater than 20 with an abnormal fetal heart rate and pattern. Which of the following actions should the nurse take first? 1. Notify the healthcare provider. 2. Turn off the oxytocin infusion. 3. Turn the client to her left side. 4. Increase the maintenance IV fluids. The correct answer is 2. The client is experiencing uterine hyperstimulation from the oxytocin. The first intervention should be to stop the oxytocin infusion, which may be the cause of the long, frequent contractions, elevated resting tone, and abnormal fetal heart patterns. Only after turning off the oxytocin should the nurse turn the client to her left side to better perfuse the mother and fetus. Then she should increase the maintenance IV fluids to allow available oxygen to be carried to the mother and fetus. When all other interventions are initiated, she should notify the healthcare provider. Approximately 15 minutes after birth of a viable term neonate, a multiparous client has chills. Which of the following should the nurse do next? 1. Assess the client's pulse rate. 2. Decrease the rate of intravenous fluids. 3. Provide the client with a warm blanket. 4. Assess the amount of blood loss. The correct answer is 3. A chill shortly after birth is a common, normal occurrence. Warm blankets can help provide comfort for client. It has been suggested that the shivering response is caused by a difference between internal and external body temperatures. A different theory proposes that the woman is reacting to fetal cells that have entered the maternal bloodstream through the placental site. Assessing the client's pulse rate will provide no further information about the chill. Decreasing the IV rate will not influence the length of time the client trembles. Assessing blood loss is a standard of care at this point postpartum, but has no correlation to the chill. Which of the following would be appropriate for the nurse to identify as a priority nursing problem for an infant just admitted to the hospital with a diagnosis of gastroenteritis? 1. Pain related to repeated episodes of vomiting. 2. Deficient fluid volume related to excessive losses from severe diarrhea. 3. Impaired parenting related to infant's loss of fluid. 4. Impaired urinary elimination related to increased fluid intake feeding pattern. The correct answer is 2. Given this infant's history of gastroenteritis, the priority problem would be fluid volume deficit. With gastroenteritis, vomiting and diarrhea occur, leading to the loss of fluids. This loss of fluids is problematic in infants because a higher proportion of their body weight is water. Pain is not a priority problem, although the nurse should continue to assess the infant for pain. There are no data to indicate impaired parenting. Impaired urinary elimination is related to the infant's fluid volume deficit resulting from vomiting and diarrhea associated with gastroenteritis. If the infant's fluid volume deficit is not corrected, then this nursing diagnosis may become the priority. A mother asks, how should I bathe my baby now that he's had surgery for his inguinal hernia? Which of the following instructions should the nurse give the mother? 1. Clean his face and diaper area for 2 weeks. 2. Use sterile sponges to cleanse the inguinal incision. 3. Give him a sponge bath daily for 1 week. 4. Give the infant full tub baths every day. The correct answer is 3. The incision must be kept as clean and dry as possible. Therefore, daily sponge baths are given for about 1 week postoperatively. Cleaning the infant's face and diaper area should occur at least daily and continuously, not limited to a 2-week period. Because this type of surgery results in a wound that heals through primary intention, the skin will heal and cover the wound in 2 to 3 days. Therefore, it is not necessary to use sterile gauze to cleanse the incision. Clean technique is acceptable. Because the incision must be kept as clean and dry, full tub baths are inappropriate. Since the diagnosis of stomach cancer, the client has been having trouble sleeping and is frequently preoccupied with thoughts about how life will change. The client says, I wish my life could stay the same. Based on this information, the nurse should understand that the client, 1, is having difficulty coping, 2, has a sleep disorder, 3, is grieving, 4 is anxious. The correct answer is 3. The information presented indicates the client is grieving about the changes that will occur as a result of the diagnosis of gastric cancer. The information does not indicate the client is having difficulty coping or experiencing insomnia. The client is not demonstrating signs of anxiety. A nurse teaches a client experiencing heartburn to take 1.5 ounces of Maalox when symptoms appear. How many milliliters should the client take? Blank ml. The correct answer is 45 milliliters. 1 ounce equal to 30 milliliters. You multiply 30 by 1.5. You get 45 milliliters. The primary healthcare provider prescribes risperidone for a client with Alzheimer's disease. The nurse anticipates administering this medication to help decrease which of the following behaviors? 1. Sleep disturbances. 2. Concomitant depression. 3. Agitation and assaultiveness. 4. Confusion and withdrawal. The correct answer is 3. Antipsychotics are most effective with agitation and assaultiveness. Antipsychotics have little effect on sleep disturbances, concomitant depression, or confusion and withdrawal. A client diagnosed with dementia wanders the halls of the locked nursing unit during the day. To ensure the client's safety while walking the halls, the nurse should do which of the following? 1. Administer PRN haloperidol to decrease the need to walk. 2. Assess the client's gait for steadiness. 3. Restrain the client in a geriatric chair. 4. Administer PRN lorazepam to provide sedation. The correct answer is 2. Elderly clients have increased risk for falls due to balance problems, medication use, and decreased eyesight. Haldol may cause extrapyramidal side effects, which increase the risk for falls. The client is not agitated, so restraints are not indicated. Lorazepam may increase fall risk and cause paradoxical excitement. When developing the plan of care for a multiparous client in active labor who receives an epidural anesthetic, which of the following would the nurse anticipate that the primary health care provider will prescribe if the client develops moderate hypotension? 1. Ephedrine. 2. Epinephrine. 3. Methylergonavine. 4. Atropine sulfate. The correct answer is 1. The drug of choice when hypotension occurs as a result of epidural anesthesia is ephedrine sulfate because it provides a quick reversal of the vasodilator effects of the anesthesia. Epinephrine is typically used to treat anaphylactic shock. Methylergonavine is a vasoconstrictor that is used for severe postpartum hemorrhage. Atropine sulfate is used to dry the oral and respiratory secretions and may be used during operative procedures. On a home visit following discharge from the hospital after treatment for severe gastroenteritis, the mother tells the nurse that her toddler answers no and is difficult to manage. After discussing this further with the mother, the nurse explains that the child's behavior is most likely the result of which of the following? 1. Beginning leadership skills. 2. Inherited personality trait. 3. Expression of individuality. 4. Usual lack of interest in everything. The correct answer is 3. The no behavior demonstrated by a toddler is typical of this age group as the child attempts to be self-assertive as an individual. The negativism does not demonstrate an inherited personality trait or disinterest. Rather, it reflects a developmental task of establishing autonomy. The toddler is attempting to exert control over the environment. It is too early to assess leadership qualities in a toddler. An infant with Hirschsprung's disease is to be discharged 1 or 2 days after surgery to create a colostomy. After teaching the infant's parents about the overall effects of their infant surgery, the nurse determines that the teaching has been effective when the parents state which of the following? 1. His abdomen will be large for a while. 2. When he's ready, toilet training may be difficult. 3. We need to limit his intake of dairy products. 4. We will give him vitamin supplements until he is an adolescent. The correct answer is 2. Toilet training is commonly more difficult for children who have undergone surgery for Hirschsprung's disease than it is for other children. This is because of the trauma to the area and the associated psychological implications. Abdominal distension is an early sign of infection, and therefore the parents need to report it to the primary care provider. Typically, dietary restrictions are not required. Usually, the infant is placed on an age-appropriate diet. Vitamin supplementation is not necessary if the infant's dietary intake is adequate. 1 month following a subdural gastrectomy for cancer, the nurse is evaluating the nursing care goal related to nutrition. Which of the following indicates that the client has attained the goal? The client has 1. Regain weight loss. 2. Resume normal dietary intake of 3 meals a day. 3. Control nausea and vomiting through regular use of antiemetics. 4. Achieved optimal nutritional status through oral or parenteral feedings. The correct answer is 4. An appropriate expected outcome is for the client to achieve optimal nutritional status through the use of oral feedings or total parenteral nutrition. TPN may be used to supplement oral intake, or may be used alone if the client cannot tolerate oral feedings. The client would not be expected to regain lost weight within 1 month after surgery or to tolerate a normal dietary intake of 3 meals a day. Nausea and vomiting would not be considered an expected outcome of gastric surgery, and regular use of antiemetics would not be anticipated. The nurse is preparing to teach a client with a peptic ulcer about the diet that should be followed after discharge. The nurse should explain that the client should eat which of the following? 1. Bland foods. 2. High protein foods. 3. Any foods that are tolerated. 4. A glass of milk with each meal. The correct answer is 3. Diet therapy for ulcer disease is a controversial issue. There is no scientific evidence that diet therapy promotes healing. Most clients are instructed to follow a diet that they can tolerate. There is no need for the client to ingest only a bland or high-protein diet. Milk may be included in the diet, but it is not recommended in excessive amounts. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse discusses the possibility of a client's attending day treatment for clients with early Alzheimer's disease. Which of the following is the best rationale for encouraging day treatment? 1. The client would have more structure to his day. 2. Staff are excellent in the treatment they offer clients. 3. The client would benefit from increased social interaction. 4. The family would have more time to engage in their daily activities. The correct answer is 3. The best rationale for day treatment for the client with Alzheimer's disease is the enhancement of social interactions, more daily structure, excellent staff, and allowing caregivers more time for themselves are all positive aspects, but they are less focused on the client's needs. A client is induced with oxytocin. The fetal heart rate is showing accelerations lasting 15 seconds and exceeding the baseline with fetal movement. What action associated with this finding should the nurse take? 1. Turn the client to her left side. 2. Administer oxygen via face mask at 10 to 12 liters a minute. 3. Notify the healthcare provider of the situation. 4. Document fetal well-being. The correct answer is 4. Accelerations are episodic and occur during fetal movement, demonstrate fetal well-being. Turning the client to the left side, applying oxygen by face mask, and notifying a healthcare provider are interventions used for late and variable decelerations indicating the fetus is not tolerating the induction process well. A multigravida client who is 10 centimeters dilated is admitted to the labor and birth unit. In addition to supporting the client, priority nursing care includes 1. Turning on the infant warmer. 2. Increasing IV fluids. 3. Determining the client's preferences for pain control. 4. Providing client education regarding care of a newborn. The correct answer is 1. Nursing care for this client includes providing support, preparing for childbirth, assessing for potential complications, and providing for care of the newborn. Turning on the warmer is the best choice for providing for the care of the newborn. Oxygen and IV fluids may be indicated if variable or late decelerations are noted on the fetal heart monitor, but decelerations are not indicated in the question. It is likely too late for pharmacologic pain relief for a multigravida client. Education regarding care of a newborn is not appropriate at this time. The mother of a toddler who has just been admitted with severe dehydration secondary to gastroenteritis says that she cannot stay with her child because she has to take care of her other children at home. Which of the responses by the nurse would be most appropriate? 1. You really shouldn't leave right now. Your child is very sick. 2. I understand, but feel free to visit or call anytime to see how your child is doing. 3. It really isn't necessary to stay with your child. We'll take very good care of him. 4. Can you find someone to stay with your children? Your child needs you here. The correct answer is 2. The nurse's best course of action would be to support the mother. This is best done by conveying understanding and encouraging the mother to visit or call. Telling the mother that she shouldn't leave and that the child is very sick is critical and insensitive. Additionally, it implies guilt should the mother leave. Commenting that the child does not need anyone is not appropriate or true. Toddlers, in particular, need family members present because of the stresses associated with hospitalization. They experience separation anxiety, a normal aspect of development, and need constancy in their environment. Asking the mother to find someone else to stay with her children is inappropriate. The children at home also need the support of the mother and or other family members to minimize the disruptions in family life resulting from the toddler's hospitalization and to maintain consistency. During physical assessment of a 4-month-old infant with Hirschsprung's disease, the nurse should most likely note which of the following? 1. Scaphoid-shaped abdomen. 2. Weight less than expected for height and age. 3. Cyanosis of the fingers and toes. 4. Hyperactive deep tendon reflexes. The correct answer is 2. Infants with Hirschsprung's disease typically display failure to thrive, with poor weight gain due to malabsorption of nutrients. Therefore, the nurse would expect to see a child who weighs less than that which is expected for height and age. A distended, rather than a scaphoid-shaped, abdomen would be noted. Cyanosis of fingers and toes is associated with congenital heart disease. Hyperactive deep tendon reflexes are associated with upper motor neuron problems, such as cerebral palsy. A client has a nasogastric tube following a subdural gastrectomy. The nurse should 1. Irrigate the tube with 30 milliliters of sterile water every hour if needed. 2. Reposition the tube if it is not draining well. 3. Monitor the client for nausea, vomiting, and abdominal distension. 4. Turn the machine to high suction if the drainage is sluggish on low suction. The correct answer is 3. Nausea, vomiting, or abdominal distension indicates that gas and secretions are accumulating within the gastric pouch due to impaired peristalsis or edema at the operative site and may indicate that the drainage system is not working properly. Saline solution is used to irrigate NG tubes. Hypotonic solutions, such as water, increase electrolyte loss. In addition, a physician's prescription is needed to irrigate the NG tube because this procedure could disrupt the suture line. After gastric surgery, only the surgeon repositions the NG tube because of the danger of rupturing or dislodging the suture line. The amount of suction varies with the type of tube used and is prescribed by the physician. High suction may create too much tension on the gastric suture line. The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, the UAP reports the client, who was previously afebrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid bore-like abdomen, and developing signs of shock. Telling the assistant to change thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing by mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate. When providing family education for those who have a relative with Alzheimer's disease about minimizing stress, which of the following suggestions is most relevant? 1. Allow the client to go to bed 4 to 5 times during the day. 2. Test the cognitive functioning of the client several times a day. 3. Provide reality orientation, even if the memory loss is severe. 4. Maintain consistency in environment, routine, and caregivers. The correct answer is 4. Change increases stress. Therefore, the most important and relevant suggestion is to maintain consistency in the client's environment, routine, and caregivers. Although rest periods are important, going to bed interferes with the sleep-wake cycle. Rest in a recliner chair is more useful. Testing cognitive functioning and reality orientation are not likely to be successful and may increase stress if memory loss is severe. Nursing staff are trying to provide for the safety of an elderly female client with moderate dementia. She is wandering at night and has trouble keeping her balance. She has fallen twice but has had no resulting injuries. The nurse should 1. Move the client to a room near the nurse's station and install a bed alarm. 2. Have the client sleep in a reclining chair across from the nurse's station. 3. Help the client to bed and raise all 4 bed rails. 4. Ask a family member to stay with the client at night. The correct answer is 1. Using a bed alarm enables the staff to respond immediately if the client tries to get out of bed. Sleeping in a chair at the nurse's station interferes with the client's restful sleep and privacy. Using all 4 bed rails is considered restraint and unsafe practice. It is not appropriate to expect a family member to stay all night with the client. The nurse prepares a client for lumbar epidural anesthesia. Before anesthesia administration, the nurse instructs the client to assume which of the following positions? 1. Lithotomy. 2. Side lying. 3. Knee to chest. 4. Prone. The correct answer is 2. Lumbar epidural anesthesia is usually administered with a client in a sitting or a left side lying position with shoulders parallel and legs slightly flexed. These positions expose the vertebrae to the anesthesiologist. Paracervical and local anesthetics are usually administered with a client in a lithotomy position. The knee to chest and prone positions are not used for anesthesia administration. The mother of a toilet-trained toddler who was admitted to hospital for severe gastroenteritis and subsequent dehydration, and is now at home asks the nurse why the child still wets the bed. Which of the following should be the nurse's best response? 1. Hospitalization is a traumatic experience for children. Regression is common, and it takes time for them to return to their former behavior. 2. The stress of hospitalization is hard for many children, but usually they have no problems when they return home. 3. After returning home from being hospitalized, children still feel they should be the center of attention. 4. Children do not feel comfortable in their home surroundings once they return home from being hospitalized. The correct answer is 1. Hospitalization is a traumatic time for a child, and it takes some time to readjust to the home environment. The child may regress at home for a period until she feels comfortable. Children normally do not dislike their home environment. In fact, they usually are eager to get home to familiar surroundings where they feel safe. A mother brings her 3-month-old child into the emergency department. The child is listless with dry mucous membranes, tending of the skin on the forehead, a depressed fontanelle, and a history of vomiting and diarrhea for the last 36 hours. In what order from first to last should the nurse implement the primary care provider prescriptions? 1. Obtain vital signs and wait. 2. Insert an IV and infuse fluids. 3. Apply a urine collection bag. 4. Draw blood for laboratory tests. The correct order is 1, 3, 2, and 4. The nurse should first obtain vital signs and evaluate the child for signs of shock or cardiac arrhythmias. The weight can also be obtained at this time to estimate the amount of fluid lost. The nurse should next apply the urine collection bag. As soon as possible after these steps, the nurse should insert an IV to replace lost fluids, electrolytes, and sugar to reduce the incidence of metabolic acidosis created by the lack of calorie intake and the loss of electrolytes. Blood should be drawn to assess the severity of electrolyte imbalance and other possible causes for the diarrhea and vomiting. When obtaining the nursing history from the mother of an infant with suspected intussusception, which of the following questions would be most helpful? 1. What do the stools look like? 2. When was the last time your child urinated? 3. Is your child eating normally? 4. Has your child had any episodes of vomiting? The correct answer is 1. For the infant with intussusception, stools characteristically have the appearance of currant jelly because of the intestinal inflammation and hemorrhage resulting from intestinal obstruction. These stools occur later in the course of the disease process. Questions that focus on urination, vomiting, and food intake do not elicit information about the effects of intussusception. A client with a peptic ulcer has been instructed to avoid intense physical activity and stress. Which strategy should the client incorporate into the home care plan? 1. Conduct physical activity in the morning in order to be able to rest in the afternoon. 2. Have the family agree to perform the necessary yard work at home. 3. Give up jogging and substitute a less demanding hobby. 4. Incorporate periods of physical and mental rest in the daily schedule. The correct answer is 4. It would be most effective for the client to develop a health maintenance plan that incorporates regular periods of physical and mental rest in the daily schedule. Strategies should be identified to deal with the types of physical and mental stressors that the client needs to cope in the home and work environments. Scheduling physical activity to occur only in the morning would not be restful or practical. There is no need for the client to avoid yard work or jogging if these activities are not stressful. A client who has a history of a mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Ms. S is a 58-year-old African-American woman who was admitted to the coronary care unit from the emergency department with reports of chest pressure and indigestion associated with nausea. She started feeling ill about 10 hours before she called her daughter, who brought her to the emergency department for admission. She told the nurse that she tried drinking water and took some bismuth subsalicylate that was in her bathroom medicine cabinet. She also tried lying down to rest, but none of these actions helped. She states it just gets worse and worse. Ms. S has been under a healthcare provider's care for the past 12 years for management of hypertension and swelling in her ankles. She was a smoker for 43 years but quit 1 year ago. Her past medical history includes gallbladder disease and gastroesophageal reflux disease. In the emergency department, admission laboratory tests, including levels of cardiac markers, were performed, and a 12-lead electrocardiogram was taken. Ms. S's CCU vital sign values on admission are as follows: blood pressure 174/92, heart rate 120 to 130 beats per minute, irregular, respiratory rate 30 to 34 breaths per minute, temperature 99.8 degrees Fahrenheit. Question 1. Based on Ms. S's admission vital signs, which HCP orders would the nurse expect? Select all that apply. 1. Continuous cardiac monitoring. 2. Blood pressure checks every 10 minutes. 3. Oxygen at 2 liters per nasal cannula. 4. Instruct patient to breathe and rebreathe into a paper bag. 5. Acetaminophen 650 mg, as needed, for temperature greater than 99 degrees Fahrenheit. 6. Check apical heart rate with each set of vital signs. The correct answers are 1. Continuous cardiac monitoring, 3. Oxygen at 2 liters per nasal cannula, and 6. Check apical heart rate with each set of vital signs. Rationale. Because the patient's heart rate is rapid and irregular, she should be on a continuous cardiac monitor, and her apical pulse should be monitored. Her O2 saturation is low normal, and her heart rate is rapid and irregular, so supplemental oxygen will be useful to her heart. Although her blood pressure is high and needs to be monitored, every 10 minutes would not allow for patient rest. Adding oxygen to increase myocardial oxygen levels may help restore Ms. S's respiratory rate to normal. Using a bag is a strategy for a patient who is hyperventilating and is not appropriate in this case. Acetaminophen is usually ordered for a higher temperature. Also, the HCP would likely want to discover the reason for any very elevated temperature, so it could be treated. Question 2. Which risk factors from Ms. S's history would suggest a possible cardiac problem to the nurse? Select all that apply. 1. Hypertension for 12 years. 2. Smoked for 43 years, quit smoking 1 year ago. 3. Surgery for gallbladder removal 1 year ago. 4. Ms. S's father died at age 42 from a heart attack. 5. Patient's weight is 278 pounds. 6. Diet includes fast foods 3 to 5 times a week. 7. Patient is an African American female. 8. History of gastroesophageal reflux disease. 9. Report of chest pressure and indigestion associated with nausea. The correct answers are 1. Hypertension for 12 years, 2. Smoked for 43 years, quit smoking 1 year ago, 4. Ms. S's father died at age 42 from a heart attack, 5. Patient's weight is 278 pounds, 6. Diet includes fast foods 3 to 5 times a week, 7. Patient is an African American female, and 9. Report of chest pressure and indigestion associated with nausea. Rationale. Risk factors for cardiac problems include hypertension, family history, obesity, and high-fat diets. African Americans have higher rates of high blood pressure, high cholesterol, obesity, and diabetes, which are major risk factors for heart disease. Symptoms of chest pressure with indigestion and nausea are signs that suggest a heart problem. Gallbladder surgery and gastroesophageal reflux disease would not be risk factors. Quitting smoking would be a risk factor, and the years that the patient smoked would be a strong risk factor. Question 3. Which action is best for the nurse to delegate to a new assistive personnel, orienting to the CCU when caring for Ms. S? 1. Placing the patient on a cardiac telemetry monitor. 2. Drawing blood to test cardiac marker levels and sending it to the laboratory. 3. Obtaining a 12-lead ECG. 4. Checking and recording the patient's intake and output. The correct answer is 4. Checking and recording the patient's intake and output. Rationale. Checking and recording intake and output are within the scope of practice for APs. Initiating telemetry, performing venipuncture, and obtaining ECG require additional education and training, and would not be delegated to a new AP. Attaching ECG leads may be done by APs in some facilities, as may venipuncture and ECG recording. The APs performing these tasks, however, would require additional specialized training. These actions are generally considered to be within the scope of practice of licensed nurses. Question 4. Which action prescribed by the healthcare provider for Ms. S takes first priority at this time? 1. Measure vital signs every 2 hours. 2. Obtain a 12-lead ECG every 6 hours. 3. Place the patient on a cardiac monitor. 4. Check levels of cardiac markers every 6 hours. The correct answer is 3. Place the patient on a cardiac monitor. Rationale. Cardiac monitoring is the highest priority because the patient's heart rate is rapid and irregular, and the patient is experiencing chest pressure. The patient is at risk for life-threatening dysrhythmias, such as frequent premature ventricular contractions. Measuring vital signs every 2 hours, checking levels of cardiac markers, and recording a 12-lead ECG every 6 hours are important to accomplish, but cardiac monitoring takes first precedence at this time.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 5. Ms. S's cardiac telemetry monitor shows a rhythm of sinus tachycardia, with frequent premature ventricular contractions and short runs of ventricular tachycardia. Which drug should the nurse be prepared to administer first? 1. Amiodarone IV push. 2. Nitroglycerin sublingually. 3. Morphine sulfate IV push. 4. Atenolol IV push. The correct answer is 1. Amiodarone IV push. Rationale. With frequent PVC, the patient is at risk for life-threatening dysrhythmias, such as ventricular tachycardia or ventricular fibrillation. The patient is already showing short runs of ventricular tachycardia. Amiodarone is an antidysrhythmic drug used to control ventricular dysrhythmias. Nitroglycerin and morphine can be given for chest pain relief. Atenolol is a beta blocker, which can be used to control heart rate and decrease blood pressure. Question 6. Ms. S tells the nurse that she has worsening chest discomfort. The cardiac monitor shows ST segment elevation, and the nurse notifies the HCP. Which prescribed action takes the highest priority at this time? 1. Administer morphine sulfate 2 mg IV push. 2. Schedule an ECG. 3. Draw blood for coagulation studies. 4. Administer a histamine 2 blocker every 12 hours. The correct answer is 1. Administer morphine sulfate 2 mg IV push. Rationale. Morphine sulfate has been ordered to relieve the chest discomfort that is common when a patient has an acute myocardial infarction. Relief from the chest pain is the highest priority at this time. Histamine 2 blockers are used to prevent gastric ulcers. Scheduling an ECG or drawing blood for coagulation studies, although important, will not help relieve chest discomfort. Question 7. Because Ms. S continues to experience chest discomfort and has elevated levels of cardiac markers, the following interventions have been prescribed by the healthcare provider. Which interventions should the nurse delegate to an experienced AP? Select all that apply. 1. Measuring vital signs every 2 hours. 2. Accurately recording intake and output. 3. Administering tenecteplase IV push. 4. Drawing blood for coagulation studies. 5. Assessing the cardiac monitor every 4 hours. 6. Assisting the patient to the bedside commode. 7. Helping the patient with morning care and partial bed bath. 8. Assessing the patient's pain level. 9. Reminding the patient to report any episodes of chest discomfort. The correct answers are 1. Measuring vital signs every 2 hours, 2. Accurately recording intake and output, 6. Assisting the patient to the bedside commode, and 7. Helping the patient with morning care and partial bed bath. Rationale: measuring vital signs, recording intake and output, and assisting patients with activities of daily living are all within the scope of practice of the AP. Administration of IV drugs, venipuncture for laboratory tests, interpreting ECGs, and assessments are beyond the scope of practice of APs and are applicable to the practice scope of the professional nurse. In some facilities, APs may receive additional training to perform venipuncture, but the nurse would need to assess the AP's ability to safely perform this skill before delegation. Question 8. Patient is scheduled for an emergent cardiac catheterization with possible percutaneous coronary intervention. Ms. S asks the nurse what is involved with this procedure. What is the nurse's best response? 1. It is a procedure that is usually done on patients who have heart attacks to diagnose blockages in the arteries that feed the heart. 2. The cardiologist will use a catheter to inject dye and locate narrowed arteries, then may inflate a balloon to open the artery and place a stent to keep it open. 3. Cardiac catheterization is usually performed on an outpatient basis to determine whether or not you have had a heart attack. 4. After the cardiac catheterization, you will come back to the coronary care unit, where you will be on bed rest for 6 to 8 hours, and we will check your vital signs often. The correct answer is 2. The cardiologist will use a catheter to inject dye and locate narrowed arteries, then may inflate a balloon to open the artery and place a stent to keep it open. Rationale: the nurse's best response should be attentive to and answer the patient's question. For the cardiac catheterization, the patient is taken to a special lab, where the cardiologist uses an invasive catheter with injectable dye to locate and diagnose narrowed sections of coronary arteries. For percutaneous coronary intervention, a catheter is placed with a balloon, which can be inflated to open the narrowed section, and a stent can be left in place to keep the artery opened.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 9. Ms. S has returned to the CCU after a cardiac catheterization and a percutaneous coronary intervention procedure. The nurse knows which of the following is within the scope of practice of the LPN/LVN. 1. Reminding the patient to remain on bed rest, with the insertion site extremity straight. 2. Preparing a teaching plan that includes activity restrictions and risk factor modification. 3. Measuring the patient's vital signs every 15 minutes for the first hour. 4. Assessing the catheter insertion site for bleeding or hematoma formation. 5. Monitoring peripheral pulses, skin temperature, and skin color with each measurement of vital signs. 6. Administering 2 tablets of acetaminophen for back pain. The correct answers are 1. Reminding the patient to remain on bed rest, with the insertion site extremity straight. 3. Measuring the patient's vital signs every 15 minutes for the first hour. 4. Assessing the catheter insertion site for bleeding or hematoma formation. 5. Monitoring peripheral pulses, skin temperature, and skin color with each measurement of vital signs. And 6. Administering 2 tablets of acetaminophen for back pain. Rationale. All of these interventions are within the scope of practice of an experienced LPN/LVN. The LPN/LVN would be instructed when to notify the RN or the HCP of any abnormal findings. Preparing a teaching plan requires additional education and is more suited to the RN's scope of practice. Taking vital signs and reminding the patient about bed rest could also be delegated to the AP. Question 10. Which information is most important to prevent recurrence of reocclusion of the coronary artery, chest discomfort, or myocardial infarction? 1. Remain on bed rest for the next 24 hours. 2. Patient will be prescribed dual antiplatelet therapy. 3. Patient should do no heavy lifting for 48 hours. 4. HCP will prescribe a beta blocker. The correct answer is 2. Patient will be prescribed dual antiplatelet therapy. Rationale. Without stent placement, the artery often reoccludes because of the artery's normal elasticity and memory. Patients who undergo percutaneous coronary intervention are required to take DAT consisting of aspirin and a platelet inhibitor to prevent recurrence of artery blockage, chest pain, and myocardial infarction. Patients are not kept on bed rest for 24 hours, rather, they are instructed to do no heavy lifting for several days after this procedure, and they are often prescribed a beta blocker to slow heart rate and lower blood pressure. Question 11. Ms. S's daughter asks the nurse why her mother did not receive a clotbuster drug. What is the nurse's best response? 1. Thrombolytic agents, also called clot busters, are most effective when administered within the first 6 hours of a coronary event. 2. Thrombolytic drugs are much more effective when used for patients who have had a recent stroke. 3. Thrombolytic drugs work better for patients who have a heart attack at a much younger age. 4. Contraindications for these drugs include recent surgeries, and your mother had gallbladder surgery a year ago. The correct answer is 1. Thrombolytic agents, also called clot busters, are most effective when administered within the first 6 hours of a coronary event. Rationale. Thrombolytic therapy using fibrinolytics dissolves thrombi in the coronary arteries and restores myocardial blood flow. Intracoronary fibrinolytics may be delivered during cardiac catheterization. Thrombolytic agents are most effective when administered within the first 6 hours of a coronary event. They are used in men and women, young and old. Question 12. Ms. S's condition is stable, and she has been transferred to the cardiac step-down unit. What should the step-down nurse instruct the AP to report immediately? 1. Temperature of 99 degrees Fahrenheit with morning vital sign monitoring. 2. Chest pain episode occurring during morning care. 3. Systolic blood pressure increases of 8 after morning care. 4. Heart rate increases of 10 beats per minute after ambulation. The correct answer is 2. Chest pain episode occurring during morning care. Rationale. Chest pain can be an indicator of additional myocardial muscle damage. Additional episodes of chest pain significantly affect the patient's plan of care. Small increases in heart rate and blood pressure after activity are to be expected. The patient's temperature, only 0.2 degrees Fahrenheit higher than at admission, is not a priority at this time, but it will need continued monitoring.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 13. The HCP prescribes captopril 12.5 mg orally twice daily, and hydrochlorothiazide 25 mg orally daily. Which information would the nurse be sure to include when teaching Ms. S about these drugs? 1. Take your hydrochlorothiazide in the morning. 2. If you miss a dose of captopril, take 2 tablets next time. 3. Avoid foods that are rich in potassium, such as bananas and oranges. 4. You should expect an increase in blood pressure with these drugs. The correct answer is 1. Take your hydrochlorothiazide in the morning. Rationale. Hydrochlorothiazide is a thiazide diuretic used to correct edema and lower blood pressure, and it should be taken in the morning, so that its diuretic effects do not keep the patient up during the night. A side effect of hydrochlorothiazide is loss of potassium, and patients may require potassium supplementation. Captopril is an angiotensin-converting enzyme inhibitor that lowers blood pressure. It is never appropriate to take twice the dose of this drug. Question 14. The HCP orders dual antiplatelet therapy for Ms. S. What is the nurse's highest priority concern for this patient? 1. Reminding the patient to do no heavy lifting while hospitalized. 2. Assessing the progression of walking in the halls. 3. Teaching the patient to apply oxygen for any shortness of breath. 4. Monitoring the patient for any form of bleeding. The correct answer is 4. Monitoring the patient for any form of bleeding. Rationale. Dual antiplatelet therapy is suggested for all patients with acute coronary syndrome, incorporating aspirin and either clopidogrel or ticagrelor. The major side effect for each of these agents is bleeding. Observe for bleeding tendencies, such as nosebleeds or blood in the stool. Medications will need to be discontinued if evidence of bleeding occurs. Question 15. The HCP prescribes atenolol 50 mg each morning for Ms. S. Which of the following relates to this drug? 1. Hold the drug if the patient's blood pressure is higher than 100/80. 2. Give the drug if the patient's respiratory rate is greater than 30 breaths per minute. 3. Hold the drug if the patient's heart rate is less than 60 beats per minute. 4. Give the drug if the patient's blood pressure is less than 90/50. The correct answer is 3. Hold the drug if the patient's heart rate is less than 60 beats per minute. Rationale. Atenolol is a beta-blocker drug. Do not give beta-blockers if the pulse rate is below 60, or the systolic blood pressure is below 100 mm of mercury, without first checking with the HCP. The beta-blocking agent may lead to persistent bradycardia, or further reduction of systolic blood pressure, leading to poor peripheral and coronary perfusion. Question 16. Which activities could the nurse delegate to the AP, assisting Ms. S during Phase 1 of cardiac rehabilitation? Select all that apply. 1. Assist with Ms. S's morning bath as needed. 2. Refer Ms. S to a monitored cardiac rehab program. 3. Ambulate with Ms. S to the bathroom. 4. Administer Ms. S's morning doses of captopril and hydrochlorothiazide. 5. Assist with progressive ambulation in the hall. 6. Assess Ms. S for additional chest pain or pressure. The correct answers are 1. Assist with Ms. S's morning bath as needed, 3. Ambulate with Ms. S to the bathroom, and 5. Assist with progressive ambulation in the hall. Rationale. Cardiac rehabilitation is the process of actively assisting the patient with cardiac disease in achieving and maintaining a vital and productive life, while remaining within the limits of the heart's ability to respond to increases in activity and stress. It can be divided into 3 phases. Phase 1 begins with the acute illness and ends with discharge from the hospital. Activities during this phase that could be delegated to an AP include assisting with morning care such as a bath, assisting a patient to the bathroom, and assisting with progressive ambulation in the hall. The nurse would be sure to instruct the AP to stop any activity that caused chest pain or pressure and report this at once. Referrals, administering drugs, and assessing patients require additional educational preparation and are suitable for professional nurses.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 17. Before discharging Ms. S, the HCP orders an electrocardiogram. This test reveals normal sinus rhythm with a heart rate of 87 beats per minute. What is the nurse's best action at this time? 1. Delay the patient's discharge until she is seen by the HCP. 2. Administer the patient's next dose of atenolol 3 hours early before she goes home. 3. Contact the HCP and ask about drawing an additional set of cardiac markers. 4. Document this finding as the only action and prepare for discharge. The correct answer is 4. Document this finding as the only action and prepare for discharge. Rationale. Normal sinus rhythm with a rate of 87 beats per minute is a normal finding. There is no need to delay the patient's discharge, give early medications, or draw additional cardiac markers. The nurse would document this as a normal finding and prepare the patient for discharge.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.